Hello? Hello? Start na tayo? Good evening. Okay, so ang topic natin ngayong gabi is about special senses. Mainly, we'll be talking about the eyes and the ears, no, and all the other conditions underlying it. Okay? So, ang mga topic na i-discuss ko is yung most commonly na tinatanong sa NCLEX. Okay? Additionally, no, sometimes marami kasing nagtatanong, for example, may nilagay ako doon sa topic na give antibiotic. Okay? As long as hindi ko specify kung anong antibiotic na ibibigay, don't worry self about it. Okay? Hindi nyo kailangan i-worry. Kasi lahat ng kailangan ma-specify, isi-specify ko naman. Okay? So let's start. First topic natin is about the eyes. So, pahapyaw lang na anatomy and physiology. Don't focus so much in this. They don't ask anatomy and physiology in NCLEX. Okay? So para may background lang tayo. So the eyes, no? The eyes has different parts. Meron tayong external parts of the eyes and internal parts of the eye. The external part, no, has different functions as well. Okay? Meron tayong conjunctiva. Okay, we have the conjunctiva. Now, the conjunctiva is separated into two. Meron tayong palpebral and bulbar conjunctiva. For example, ito yung mata natin. No, yan yung mata. The bulbar conjunctiva is the one nearest to the eye. Ito yung balot sa mata. Whereas the palpebral, no, this is the one furthest from the eye. This is the one we use to assess or kung nagbibigay tayo ng gamot. Palpebral yung ginagamit natin. Okay? So what is the main function of your conjunctiva? Well, it's a mucous membrane. No, it's a mucous membrane, therefore it protects the eye, no? It protects the eye and also nourishes it, keeping it lubricated. So it's for protection and lubrication. As well as it helps us assess the eye for any condition. For example, if the patient has anemia, no? Iron deficiency anemia, pagtingin natin sa palpebral, usually pale na ang color. Okay, next, yung sclera, no? The sclera is the white portion of your eye. Yan, yung maputi. So ano tong sclera? Ano ang function niya? Its main function is that it keeps the eye its shape, no? Shape. At the same time, the sclera is very tough and fibrous, no? Matibay siya. Therefore, not only does it keep the eye's shape, it also protects the eye from injury. Okay? And when we assess the sclera, no, pwede din natin makita if there are other underlying condition. For example, if the sclera is yellow, no, nag-yellow-yellow yung sclera niya, then we can assess if the patient has jaundice. No? If the sclera has lots of capillaries, yan, mga ganyan. Ibig sabihin, the patient has either irritated eyes, dry eyes, or dehydrated. So, sa sclera pa lang, we can assess different underlying conditions. Okay, next, yung ating cornea. No? What is the main function of your cornea? Now, the cornea, they call this the main refractor of light. Main refractor of light. No? When you say main refractor of light, it directs light, no? Nire-redirect niya yung light papasok sa ating pupils. For example, there's a light source, no? Here, ganyan. Ang ginagawa ng cornea, i-redirect niya yan para ma-focus sa pupils natin. So we could see that area. Okay, so that's its main function. It redirects or it moves light towards the pupils. Okay, next. Inside your cornea, meron tayong anterior chamber. And inside that anterior chamber, you have your aqueous humor. The aqueous humor helps maintain intraocular pressure. Now, it maintains IOP, its main function. Aside from that, your aqueous humor also has glucose and other nutrients to keep the eye, no, nutrition filled. So para maraming nutrition yung ating mata, para yung mga cells doon nabubuhay. Okay? Next, the pupils. No? The pupils. So, the pupil, ang ginagawa niya is that it controls the amount of light. No? It controls the amount of light entering the eye, or it controls the amount of light that is allowed to enter the eye. Your pupils can dilate or can constrict depending on the nervous system that is telling it to do so, di ba? For example, if it dilates, the sympathetic nervous system is telling it to dilate, no? Para siya mag-constrict, the parasympathetic naman is telling the pupils to constrict. Therefore, your perla, no, yung pupils equally round, reactive to light and accommodation, is not part of your eye assessment. Rather, it is part of your neurovital signs or neuro assessment. A neuro assessment ko siya. Because if you have abnormalities in your pupil, no? Iba yung size ng pupil, yung isa mas malaki, yung isa maliit. Or if the pupil is always dilated, it will always reveal an underlying brain issue, usually sa brainstem. Okay? So, if you have a perla, it means your brainstem is working. Okay? So again, perla is not part of your eye assessment. Okay, next, the lens. No? The lens, ito. So, the lens is a transparent biconcave organ, no, tissue, transparent biconcave tissue that main function is on accommodation. Accommodation. Accommodation is focusing and refocusing on an image. Okay, focusing and refocusing. Best way na ma-remember to is that ang ginagawa ng lens natin is it tells us how far or how near certain things are, no? For example, kung titingin ka outside your window and you will see houses na malayo, that's your lens trying to determine the distance, no? Siya nagsasabi na malayo yan, malapit yan, etc. etc. Kasi yan yung main function niya. It focuses and refocuses on image. Okay, and lastly, no, yung ating mga retina and macula. So, retina and macula. Okay? So, your retina and macula are extensions of your optic nerve. The retina, its main function is for color vision and low light vision, no, or night vision. Whereas your macula, its main function is central vision. Okay, so how does that work? Light enters your sclera, no? Well, not your sclera. Light enters from light, no, passes your sclera, and then it enters your cornea, which then is redirected towards your pupils. And once it is in your pupils, no, it is focused or refocused by your lens, and eventually ibabato na siya sa ating retina and macula, which is extensions of your optic nerve, and from that it will become a electrical conduction towards your occipital part ng ating utak, no? And then doon na natin madidetermine kung ano yung image na nakikita natin. Okay? So a very simple anatomy physiology para madaling maintindihan yung mata. Any questions? Any questions? No questions? Okay, no questions? Sige, let's continue. Okay, next, these are the following assessments nurses can perform, no, when assessing the eyes. Ayan, so meron tayong visual acuity test, yung Snellen chart. So what is a Snellen chart again? It tests visual acuity, no, or how accurate your vision is. Okay? So, paano natin ito siya ginagawa? Okay, first, sasabihin natin si patient to stand 20 feet away from the chart. Okay? Stand 20 feet away from the chart. Next, tell the patient to close the left first because you are going to test the right. Okay? So first step is to close the left eye and test the right. Next, opposite na naman, close the right and then test the left. Ganyan. After that, you test both eyes na. Okay? So I know everyone here is familiar with how a Snellen chart works because ginagawa to sa, no, sa, tawag yan, sa grade school pa lang natin, sa high school, and eventually pagdating ng college, ginagawa pa rin to siya. Okay? So, how do you interpret a Snellen chart? For example, if a patient has a 20/50 vision, anong ibig sabihin daw niyan? Okay? Someone who has a 20/50 vision means that they have to stand 20 feet just to see something that is, no, what a normal person can see 50 feet away. Okay? For example, my vision, for example, itong bahay, yan. This house is 50 feet away. Okay? A normal person would stand 50 feet away to see that house. Whereas someone who has a 20/50 vision needs to stand 20 feet away from that house, no, para lang makita. Okay? So yan ang ibig sabihin ng 20/50. No? Means that you have to stand 20 feet away from the chart. You can only see what normal people can see 50 feet away from that chart. Okay. Aside from the visual acuity test, we can also perform the external eye exam. No? External eye exam is just by mainly examining the external eye. No? Titignan natin yung mata. And from that alone, we can actually see if there are other problems, no, sa patient na to. For example, if the patient has ptosis or drooping eyelids, tulad nito, no, what do you think is the underlying condition kung nagkakaroon ng ptosis si patient? Any idea? So meron ditong MG, stroke, MS, decreased acetylcholine, which is still MG. So, no, most likely meron siyang myasthenia gravis. Because someone who has a myasthenia gravis, ano nangyayari? Nawawala yung acetylcholine nila. Loss of acetylcholine means that muscle cannot contract properly. Magre-relax yung mata. And ang first na tinatamaan would be the eyelids, no? Kung meron siyang ptosis on one side, then yeah, pwede din, baka may stroke siya. Kasi ang natamaan is that one part lang. So, ptosis, makikita mo na there are other underlying condition. O what if meron siyang lid retraction? Nakita mo yung mata niya tapos ganito, no? Dilat na dilat. Anong underlying condition ang naiisip mo? Yes, no? Baka meron siyang hyperthyroid. No? Baka meron siyang Graves, di ba? So from that eyes alone, nakikita mo na yung possible condition niya. Or what if merong nystagmus? Pagtingin mo sa kanyang mata, it is oscillating back and forth, mabilis. Parang ganyan. Yung mata niya nag-oscillate, mabilis, ganyan. Anong possible condition niya? No? Pwede. Baka meron siyang multiple sclerosis. Because if you have multiple sclerosis, ang first na apektuhan ng mga nerves would be the central nervous system. So yung mata, yung natatamaan, that's why nagkakaganyan. Kung hindi naman multiple sclerosis, baka meron siyang Meniere's or vertigo. Kasi pwede din. Or, kung wala ding vertigo, walang MS, maybe the patient is, no, has Down syndrome. Kasi if you have Down syndrome, you would notice, no, by looking at their eyes, nagaano siya, nystagmus siya. It is oscillating back and forth. So, from looking at the eyes alone, no, nakikita na natin na meron siyang different underlying problems. Okay, next. Six cardinal direction of gaze, no, the movement of the eyes. Again, this one, no, it doesn't test the eye, it actually tests cranial nerves, no, because different movement of your eyes would tell you different cranial nerve function. For example, lateralization of the eye, no, pag nag-shift yung eye nyo back and forth, that's your cranial nerve 6, di ba? Movement of your eyes up and down, that's your cranial nerve 3. So, nakasulat naman dyan, yan. Okay, so mga different eye exams to siya. Other diagnostics. Before we move, any questions? Before we change slides, any questions? So I'm seeing no questions. Okay. So other diagnostic tools that can be done, but not really by nurses, pero by doctors, would be, yan, mga different diagnostic procedures. So meron tayong direct ophthalmoscopy. So this one is usually done in a dark room, no? Tapos dapat, ano ka, eye level ka. Ito yun siya, no? Ito yung direct ophthalmoscopy. Okay, this one is done to view the cornea, the lens, and the retina. So you're actually looking at the anatomical, no, structure of the eye. Okay, indirect ophthalmoscopy would still be the same as your ophthalmoscopy, pero ganito lang siya. No, they're using a different tool to monitor it. Ang slit lamp naman is that they are using light, no? And then from this light, they will angle it, okay? Because the angle of the light will tell them the structure of the eye, the anatomical structure of the eye. Okay? Tonometry is used to measure the intraocular pressure, which is 10 to 20. No? Colored vision testing, no, is to test for color blindness. And you may have seen this already. No, ito yung parang may number that is nakadot yan siya, and may mga surrounding na other colors na nakadot din, and then you will have to guess the number. So ganon. That's for color vision testing. And lastly, Amsler grid, no? They test optical coherence with this one. Optical coherence. No? Usually, the Amsler grid is used to determine presence of macular degeneration or loss of central vision. Yan. Okay? Anong samples? Sample ng anong Amsler grid? Yan, no? Yan ang Amsler grid. Okay? Any question? Ano po yung may Amsler grid? Macular degeneration. O later, papag-usapan naman din natin to siya. macular degeneration. Okay, or loss of central vision. Yan usually yung ginagamit pang test niya. Okay, any question? Before tayo mag-next slide. No question. Okay, next slide na tayo. Ngayon, ang papag-usapan natin yung mga diseases or mga disorders that affect our eye. Our first disorder would be decreased visual acuity. Okay, decrease in visual acuity. So, meron tayong different ways that our visual acuity decreases. First natin is myopia. Myopia, also commonly known as your near or far. Ang myopia, nearsightedness, correct. It is your nearsightedness. Okay? So, what causes myopia? No? First cause ng myopia, genetic. Okay? Maybe you are born with a specialized kind of eye na tinatawag nilang myopic eye, no? Someone who has a myopic eye has an eye that is longer or elongated than normal. For example, ito yung normal na mata, ganyan, bilog siya. Light enters there and then it enters your retina and macula, okay. But someone who has a myopic eye, no, mahaba yung mata niya, ganyan, no? Your light enters there and then asan lang siya, hanggang dito lang siya, no? So the light does not go towards your retina and macula. So anong mangyayari? The patient has to move nearer to the object para mapunta doon sa kanyang retina and macula. So someone who has myopic eyes have eyes that are longer than usual. So ilalagay natin dyan, long eyes. Okay, mahaba yung kanyang mata. Okay? Aside from that, environmental. Okay, environmental. Ibig sabihin, no, at an early age, someone has been exposed to prolonged screen time or prolonged screen use, no, laging nakaharap sa cellphone or sa TV, sa computer, na yung mata nila started, no, they started, adapting to that kind of vision, to that type of near vision. No, kaya humahaba yung mata nila. So, prolonged close-up activities, screen time, no, early uses of device can lead to myopia. No, aside from that, being indoors for too long, no, pag nasa loob ka lang ng bahay mo, your eyes start to adapt because everything is near you, di ba? So, being indoors for too long, yung mata mo nag-a-adapt, nagiging siyang mahaba, nagiging siyang myopic. Okay? So, yan ang common cause niya, genetic. You were born with it, mahaba yung mata mo, or environmental. You adapted to it. So, what are the symptoms naman ng ating myopic eyes? Okay? So, signs and symptoms, someone who has a myopic eye would usually hold things near to them. Di ba? Everything must be near to them. Okay? When they're reading their books, dapat malapit. When they're using their cell phone or watching television, dapat malapit. Aside from that, they start to squint, no? They start to squint, lalo na pag malayo, they squint because they are trying to focus. No? Kung hindi sila nag-squint, they close one eye. Yan. So, squinting or closing one eye to focus. Yan. Okay? So, ano naman ang complication nito? No? Someone who has severe myopic eyes, no? Pag sobrang haba na yung mata nila, they are at risk for developing retinal detachment. Okay? The retina at the back of their eyes can detach kasi very elongated na. So, ito yung pinakang delikadong complication ng extremely myopic eyes. Okay, next. Hyperopia naman tayo. If myopia is nearsightedness, myopia is farsightedness. Okay? What is the cause of myopia? Hyperopia. Okay, if myopia, ang cause nito is usually genetics or environment, si hyperopia, no, genetics lang. Okay, you're either born, and as you age, your eyes start to become, no, shorter than usual. Okay, so lalagay natin dito, meron silang short eyes. How can you tell if your myopia is severe? Well, kung gaano kalapit ikaw magbasa ng libro, kung ganito ka nakalapit magbasa ng libro, no? Ibig sabihin, severe na yung iyong myopia. Well, to tell you the truth, the only one that can say kung gaano naka-severe yung iyong myopia would be an ophthalmologist. Because they will use an ultrasound or tawag yan, slit lamp microscopy to determine the anatomical structure of your eyes. So dapat titignan nila yan, yung shape ng mata mo, kung gaano naka-severe. Okay? Okay, so si hyperopia, iba na naman yung mata nila, no? Special din. For example, ito si myopia. Ito si normal eyes, no? Bilog, eye enters, goes to your retina macula, okay lang. Whereas someone who has hyperopia, ganito na yung mata nila, no? Shorter than usual. Light enters and then lumampas sa macula and sa retina, no? So the patient has to move further back, no? Far back para makita nila yung vision nila. Again, when you have hyperopia, most common cause ito is genetics. You were born with it or age. Now, over time, your eyes become shortened as usual. No? So, ano yung signs and symptoms? Well, opposite lang ng myopia. No? Everything has to be further from you. Lahat dapat malayo. Okay? Nearby objects become blurry and then your eyes begin to strain. So yan, nag-eye strain, headache, ganon. Ano ang pinakamalaking complication naman ng tawag niyan, hyperopia? So wala namang lalagyan. Lalagay ko na lang dito ha. Okay, watch out for, okay? So if someone who was born with it, no, bata pa lang, baby pa lang, hyperopic na yung mata nila, over time, pag hindi yan siya corrected, it can lead to crossed eye, no? Or nagiging duling sila. No? Nagko-cross yung mata nila. Okay? But that is usually pag pinanganak na, mayroon ng hyperopia agad. It can lead to crossed eye. Okay? So next natin is astigmatism. No? Astigmatism. So in astigmatism, the main problem here is the cornea. No? The cornea. The main refractor or the main redirector of your light. Of the light, diba? Towards your eye. So ano nangyayari sa cornea naman nila? No? Their cornea is not a biconcave shape. No, biconcave. It's not a biconcave shape, 'di ba? Ang normal na cornea dapat for example, no. Yan yung mata and then yan yung cornea. Ganyan dapat, no? Light enters and then i-redirect nila doon. Someone who has astigmatism, iba yung shape ng cornea nila. Pwedeng ganyan yung cornea nila, no? Pwedeng yung curvature nasa taas lang, sa baba wala. So, it redirects light elsewhere. Kaya nahihirapan sila. Okay? Sir, yung hyperopia sa bata, nako-correct siya in due time. Pag hindi ganun ka-severe, no, mako-correct siya. Pero eventually, no, if it's very severe, again, it's going to be determined by the doctor, pwedeng mag-lead to crossed eye. Pwede silang maging duling. Pero it can be corrected with LASIK naman. Okay, so it depends on the severity. So ganito yung may astigmatism, no? Yung kanilang cornea is no, may problema, no? So it redirects light elsewhere kung asan siya papunta. Ganyan. So what causes astigmatism? Do you have an idea what causes astigmatism? Sinong may mga astigmatism dito? Anong sinabi ng mga doktor nyo? Ano daw ang cause? Walang sinabi ang doktor. Okay? Sabi nila meron kang astigmatism. No, problema mo na yan. Okay? Maghanap ka ng pamamaraan dyan. Okay? So, ang cause ng astigmatism is genetics siya. No? It's just, you're just born with it. Okay? Genetics lang talaga siya. So, huwag kayong maniniwala, no? For example, diagnose kayo ng astigmatism. Pagsasabihan ka, so yan kasi, lagi kang nagpaplansya ng malapit yung mata mo sa ganyan. Lagi ka cellphone, o lagi ka computer, ganyan. So, it's not caused by any environmental thing, no? Lagi ka kasi sumisilip sa mga katabi mo, kaya nagkaroon ka ng astigmatism. Hindi, no? It's caused by genetics lang talaga. Okay? You're born with it. Okay? So it's not caused by reading, no, poor lighting, no, sitting too close to TV, wala. Genetics lang. And it is corrected by mga glasses or pwede din siya makorek ng LASIK surgery. So later papag-usapan natin yun. And lastly is your presbyopia. Now, presbyopia is the loss of visual acuity because of age. No? Loss of visual acuity because of age. So presbyopia is like hyperopia, but because of age. Kaka-review ng NCLEX nagka-astigmatism. Hindi yan siya astigmatism. Ang tawag niyan, pabebe. Sumakit talagang mata ko sa kaka-review. Grabe. Pabebe ang tawag yan. Huwag kang pabebe. Hindi, joke lang. No? Sasakit talaga ang mata mo dahil na-overload ka ng information. Okay? Sobrang dami kasing pinapaaral, di ba? Isipin mo, ang OB is 2 semesters yan, 2 years. Sabi ng NCLEX, hindi. 4 days lang yan. O, di ba? So, parang pinipilit kasi lahat. Okay? Anyway, presbyopia is hyperopia in old age. Habang tumatanda ka, yung mata mo, nag-change din ng shape. So, nagkakaroon ka ng presbyopia. Okay? Any questions? No? Any questions dito? No question? Okay? So, anong treatment dito? Well, ang treatment dito is corrective lenses, yung mga glasses natin, no? Mga prescriptive lenses, or LASIK. No? Sa mga RK dyan, na mayayaman sila mommy at daddy, no? LASIK sila. Hindi, kung may pera ka, magpa-LASIK ka, of course. Yeah. Pag-usapan natin ang LASIK later. Okay? So if there are no question, let's talk about blindness, no? Nabulag. Yan. So, what is blindness? No? According to assessment, blindness can either be medically blind, no, or legally blind. Someone who is medically blind would have a visual acuity test of 20/400. Okay, ibig sabihin, if meron ditong figure, no, na 400 feet, nakikita ng mga tao, yung may 20/400, kailangan nilang lumapit 20 feet para lang makita. Okay, so ang ibig sabihin daw yan, medically blind na. Okay, ang legally blind naman, okay, would have a vision of 20/200. Okay, legally blind na daw yan siya. However, may caveat yan, no? Kasi mapapansin mo, marami namang may vision na 20/200 pataas, di ba? Pero bakit hindi sila nakakakuha ng disability card? It's because to be diagnosed medically blind or legally blind, dapat yung vision mo, no, ganyan dapat siya, or mas delikado pa, pero hindi na siya nako-correct, no? Cannot be corrected by corrective lenses or LASIK, ganyan. So doon siya nadadiagnose as legally or medically blind. Okay? Other diagnostic tests would be a contrast sensitivity testing or glare testing. Now, this one tests if may nakikitang light si patient. Okay? Light vision. No? Kung wala silang nakikitang light, ibig sabihin, bulag na talaga sila. Okay? So, anong management natin sa mga bulag? of course, normal tone of voice, no? Hindi mo naman siguro sisigawan ang bulag. Si bulag sila, 'di ba? So normal tone of voice. Additionally, orientation, no? Lagi dapat natin silang ina-alert na malapit na tayo. Always alert. Okay? Aside from that, you also alert them of their environment. No, alert them of their environment. Now, this prevents sensory deprivation. Prevent sensory deprivation. Yan. Okay, next. Use of focal points. So, ano tong mga focal points? Focal points are like landmarks, no? Are like landmarks sa kanyang environment. Okay? This provides further information sa kanyang surroundings. For example, sabihin mo sa kanya na papasok sa CR, you will pass by a cabinet or a chair or a couch, something like that. So, always ang iisipin na pag malapit na siya sa CR, may couch siyang mahawakan or may cabinet siyang matatamaan, etc. Okay? So, focal point are like landmarks. Clock placement patterns, no? Now, this one increases the autonomy in those who are blind to feed themselves, no? Because clock placement pattern are usually done in meal trays. Okay? Or sa kanilang plate. For example, ito yung plate niya. Okay? That's the plate. And then makikita natin may mga different numbers, no? Kasi for a blind person, pwede natin silang sabihan na at 12 o'clock or directly above that plate, no, sa taas nila, in front of them, nandyan yung rice, ganyan. And at 6 o'clock, nandyan yung corned beef. So, in that sense, kaya nilang kumain mag-isa, thus increasing autonomy. No? Clock placement pattern. Next, how do we assist them when walking? So, when they're walking, no, you can offer an arm, no, or a shoulder, pwede din, as long as the patient should be one step behind you and the nurse should be one step in front of the patient. Okay? Now, if they are confident enough na sila lang maglakad-lakad, we can teach them how to use their specialized blind man's cane. No? Ito yung cane na white na may red tip usually. And to use this, no, sasabihin natin sila to, number 1, hold it in their dominant hand. Okay? Number 2, it should be several inches above the floor. No? Several inches above the floor. And then, as they walk, they have to sweep the crowd. Okay? Sweep the crowd back and forth. So, ganun ang paggamit ng specialized cane. Any questions with this one? Any questions? Sweep the crowd. Sorry, no? As they walk, sweep the crowd. So, para daw nagwawalis. Ganyan. Any questions? No questions? Okay. Let's continue next slide. So, kung kaya pang makorek yung vision, ito yung pwedeng mga gamitin, no? Corrective lenses, tulad ng mga glasses natin, mga tawag yan, contact lenses, no? Mga prescripted, ganyan. When it comes to corrective lenses, lalong-lalo na yung mga contact lenses, meron tayong mga nursing interventions din doon, no? Pwede natin silang turuan how to decide, okay, kung ano yung mas best sa kanila. So for hard lenses, ano yung mga pros nito? No? Mga pros nito, it offers a clearer vision, no? Clearer yung vision nila. Next, durable din siya. clearer vision, and durable. So, hindi siya madaling masira. Kung hindi madaling masira, hindi kailangan palitan agad. Ano naman ang mga cons ng mga hard lenses natin? Okay? Well, it needs to be fitted. So, ibig sabihin, hindi siya one size fit all. No? Para sa patient lang talaga siya. Aside from that, kailangan din na babantayan kung nagkaroon ng mga scratches. Scratches because it can accumulate debris. Yan. Additionally, mas uncomfortable siya. Mas masakit siya sa mata and it takes time to get used to. Okay? What about the soft contact lenses? So ito naman yung pwede nating maturo sa kanila. When it comes to soft, it is easier to adapt to kasi mas malambot siya. Okay? It's more comfortable. However, it's not very durable. Hindi siya ganun ka strong or tough. So madali siyang masira. So it is usually replaced more. Lagi siyang pinapalitan. Okay? And it is also associated with infection. With increased risk for infection. So yan. So we can teach this to a patient to help them determine or make a proper choice as to anong gagamitin nila, hard or soft ba ng mga contact lens. Okay. Now, LASIK. Okay, so LASIK eye surgery. Now, this one indication niya is for visual acuity problems. How is this done? They would usually, ang mga nagpapa-LASIK po, permanent na ba? I'll get to that. Okay, so, ang ginagawa dito sa LASIK, they tear a flap, a thin flap on your eye, and then pag pinil nila yan off, like actually parang notebook, pinil nila yan off, and then after nila na-peel, they will use a laser to reshape the tissue beneath. So parang kinokorek nila yung anatomical structure ng mata. May it be the cornea or something else. Kinokorek nila yon. Okay? So ano yung ating nursing consideration natin? Pre-op, compliance to prophylactic antibiotic. O baka magtatanong kayo, sir, anong antibiotic? Okay? Hindi ko in-indicate. So, ibig sabihin, don't mind yourself. Just know that one of its pre-op consideration is that they have to drink the antibiotic that was indicated to them by their physician. Next, ang post-op. Use antibiotic or anti-inflammatory eye drops. Next, sleep on the unoperated side. Okay, unoperated side. When they're performing LASIK, they can't do it both eyes. Hindi pwede dalawang mata agad. Kasi kung dalawang mata agad, bulag ka for a period of time. So isang mata mo na, and pag nag-heal na yung mata na yun, isa na naman. Okay, para meron kang vision pa rin natitira. Okay, and lastly, avoid activities that can increase intraocular pressure. Okay, so what are activities that increases IOP? It's the same activity that increases ICP. Roughly the same, parehas lang sila. So, wag kang magli-lift ng heavy weights, wag kang mag-strain, ganyan. Wag kang bending past your hips, ganun. As much as possible, dapat hindi ka nagka-cough, because heavy coughing increases IOP, vomiting or retching increases IOP, ganyan. So, anything that performs Valsalva, nakaka-increase ng IOP. Ganyan. So, avoid increasing IOP. So, going back to the question, kung permanent na ba ang LASIK? Yes, permanent na siya. However, like any organ in your body, if you abuse it, masisira ulit siya. Diba? Kahit na nagpa-replace ka ng liver, tapos madami ka na naman iniinom na alak, etc., masisira pa rin siya. So, ganun din, It is a permanent solution, pero if you don't take care of your eyes well, masisira pa rin siya. So, pwede ka pa rin ma-LASIK again and again, depending kung paano mo pag-take care sa mga organs na yun. Okay? Also, it doesn't mean that you have LASIK, ang vision mo magiging 20/20 na. For example, your vision is 20/200. No? Pag ni-LASIK ka, hindi yan siya 20/20 agad. No? Because the result of LASIK surgery depends on the severity of the visual acuity problem. No? Kung severe na yung visual acuity problem mo, pag nag-LASIK ka, okay, kaya nilang i-repair yun, but they cannot perfect it. So, siguro kung may 20/200 ka, kaya siguro nilang 20/100 or 20/70. Ganyan. So, hindi perfect talaga na vision. Okay? So, ang problem kasi is, no, a common misunderstanding is, for example, they really have bad visual acuity problems, no? Very myopic, very hyperopic, etc. Tapos ang iniisip nila na, it's okay, magpapalasik lang ako and then this will all be corrected, no? It will be corrected but it will not be perfect, no? Meron ka pa ring visual acuity problem after LASIK kasi it always depends on the severity of your problem before. Ganyan. So if you're intending to have LASIKs, no, don't wait until masira na yung ano nyo, refractory errors nyo, no? For example, severe na yung visual acuity nyo and it's going to progress, no? It's going to progress. Kung kaya nyo magpalisik, palisik na kayo. Kasi kung nasa ano na siya, severe stages na siya, no? Kahit na magpapalisik kayo, hindi pa rin siya ganun ka ganda yung result. Okay? So any questions with LASIK? Our corrective lenses? Any questions? No questions? Okay. Next topic tayo, cataracts. Okay. So what happens in cataracts? Now, the problem here, the problem organ is the lens. Now, the problem tissue pala is yung lens. The lens becomes cloudy and opaque over time. Nagiging cloudy na yung mga lens natin. What are the risk factors kung bakit nagiging cloudy or opaque yung lens? One of it is aging. No? So as we age, pwedeng naapektuhan yung lens natin, nagiging opaque na siya. Genetics, pwede din. Certain conditions such as DM, Cushing's, nakaka-cause ng cataract. Medications such as corticosteroids can also cause cataract formation. So ito yung mga risk factors ng cataracts. Assessment. Cataracts is painless. Okay? It is painless, but when you look at the lens, it's opaque or cloudy siya. It offers a blurry vision, no? Meron siyang blurry vision. Aside from that, there is also a color shift. A color shift. Things that are yellow start to look brown. Things that are yellow start to look brown. And mostly lahat ng mga bagay na nakikita niya has a bluish color, discoloration. Okay? Aside from that, meron ding myopic shift, no? 'Di ba as we age, no, habang tumatanda tayo, nagkakaroon tayo ng hyperopia. Kasi presbyopia 'yan, 'di ba? Hyperopia. Nagiging farsighted ang tao. Someone who has developed cataracts will notice na their eyesight is becoming better. Bakit? Napapansin nila na nawawala na yung kanilang hyperopia. It's becoming better. No? Kasi nagkakaroon na pala sila ng myopic shift. And over time, no, nagiging myopic talaga yung vision nila. Okay? Nagiging na talagang myopic yung vision nila. To diagnose this one, Snellen chart, because may mapapansin silang myopic shift. Okay? Slit lamp microscopy and ophthalmoscopy. Now, these two can detect the anatomy, the structure of the eyes. Yan, makikita nila yung lens mismo. Kung may nangyayari bang something wrong doon. Okay? So, what are the surgeries? No? Pinaka-common natin is yung phacoemulsification. Now, phacoemulsification, okay, this is done one at a time under localized anesthesia. Okay, ang ginagawa dito is that They cut a portion in your tawag yan, sclera in your cornea. They cut a portion in your cornea, and they will use a device that will vibrate, and it will liquefy the lens, no? So para niyang dinudurog yung lens. After the lens has been liquefied, they suction it up, no? They suction it all up. And afterwards, papalitan nila ng bagong lens, no? They put a new lens. Now, in certain countries where lens replacement is not being done because of monetary issue, no, we have to take note of that. Kasi sometimes, for example, dito sa Philippines, no, may mga libreng cataract surgery naman, sometimes hindi nila nilalagyan ng bagong lens, no? Tanggalin lang nila yung nasira na lens. Pag ganyan, no, yung patient na yan nahihirapan ng mag-accommodate, no? Hindi nila napapansin or hindi nila nadidetermine ang mga distance ng mga bagay kasi wala nang bagong lens. Okay? Next, another surgery would be your extracapsular cataract extraction. Now, this one, they don't usually do this anymore, but some countries still do this, no? Ang ginagawa kasi dito is that they make a bigger incision in your eyes, no? And then from that big incision, they will pull out the cataract lens. Okay, so ang difference between phacoemulsification and extracapsular is the size of the incision, no? Ang phaco maliit lang, no? Sobrang liit lang. Tapos mabilis. Whereas extracapsular, they make a bigger incision. So the healing takes more time. Okay, so yun yung difference nila. They don't usually do the second one anymore. Okay, but some countries still do, no? Next is your peripheral iridectomy. So in peripheral iridectomy, no? Now, this one is not a cataract surgery, but ginagawa nila to as a prophylactic measure. A prophylactic measure. Because when you perform a cataract surgery, it increases the risk of increasing IOP. So the way they do this is that they cut a small hole in your iris para doon magdi-drain yung excess fluid kasi magsiswell naman yung mata. So doon siya magdi-drain. Okay, to prevent glaucoma. So prophylactic lang siya. Okay? Any questions with this one? No questions? Okay. Let's continue. So meron tayong mga different management procedures natin with cataracts. So before surgery, nakasulat dyan, no anticoagulants. As much as possible, hindi sila pwedeng mag-take ng anticoagulants. However, no, exception to the rule tayo ha. However, no, for example, the patient is taking warfarin as their maintenance medication. As long as the patient who is taking warfarin can maintain their PT to 1.5 before surgery, they can take their surgery can be continued, no? As long as yung PT nila, prothrombin time is 1.5, okay? Pwede silang magpa-surgery. So hindi totally bawal ang anticoagulant. It all depends on how the patient how the PT is controlled. Okay? NSAIDs and aspirin, ito talaga yung bawal. NSAID and aspirin should be discontinued for at least 7 days or 1 week prior surgery. Okay, next. Mydriatics are also given before surgery, usually 1 hour before surgery, 1 hour prior. So what are mydriatics? So mydriatics, they are dilating drops. No? So nakikita niyo dyan, mydriatic, letter D, dilate. It dilates the pupil. No? So ano yung mga gamot na usually binibigay dito? What is usually given is atropine, okay, phenylephrine, medications that contain phenylephrine, or other stimulants. No? They dilate the pupils. Mydriatics are given para dilated yung pupils para makita yung lens agad. No? If if the pupils are constricted, hindi mo makikita yung lens sa loob. So that's why it has to be dilated 1 hour before surgery. Okay, next, the patient dapat naka-NPO siya, no? Kasi during the procedure or before the procedure, no, nakaka-nauseate yan. When your pupils are always dilated, it's nauseating because there's so much light entering your eyes. So dapat naka-NPO. Next, no eye and face makeup para walang no mga contaminants dun sa surgery. Okay, next, after surgery. After surgery, the positioning of the patient here should be side-lying. Side-lying on the unaffected side. Unaffected. So ito yung post-op niya na positioning. Side-lying, unaffected side. Okay? So how long to siya naka-side-lying? It depends. No? It depends. Usually, ano to siya? 1 to 2 or 1 to 3 days. Ano po yung sa anticoagulants? Warfarin. Ayan. Warfarin yung nakasulat. Yan yung anticoagulant. Anyway, ano sila, side-lying sila, unaffected side, 1 to 2 or 1 to 3 days. Aside from that, no, yung kanilang mata, dapat merong shield. No? May rigid eye shield. Ito yung rigid eye shield. Rigid. Yan. So post-op, nakasuot sila ng rigid shield usually for 24 hours lang. Okay? 24 hours. For the first 24 hours ng post-op, rigid eye shield. After 24 hours, no, mag-eye shield na lang sila sa gabi. Sa umaga, hindi na kailangan. Okay, tatandaan ha, yung rigid eye shield post-op, first 24 hours lang. After 24 hours, pwede nang gabi na lang gagamitin. Sa umaga, sunglasses usually yung recommended. Okay? Now, for the pain meds, no, ang binibigay ng mga pain medications dito, drug of choice would be acetaminophen. So, paracetamol, usually. Paracetamol. Okay. Protection and cleaning. Okay? So, again, ang protection niya, no, post-op, 24 hours. Rigid eye shield. Okay? After that, no, susuotin niya na paggabi yung rigid eye shield na niya. So, paano ba yan? Pag discharge na si patient, okay, eye shield at night. Eye shield at night. Okay? Gabi niya na lang susuotin. Pag umaga, no, sunglasses. Okay? Now, this one is usually worn for 1 to 4 weeks. 1 to 4 weeks. Okay? Now, yung mata, sometimes may mga secretions to kasi may swelling, no, post-op. So, may secretions yan siya konti. To clean the secretions, okay, for example, ito yung mata niya, no, may tumutulo dyan. To clean the secretions, ito yung gagamitin natin. Or ito yung ituturo natin kay patient. Use a clean, damp washcloth. Okay? Don't use a dry washcloth. Dapat medyo basa siya because if you use a dry washcloth, masakit. So dapat clean, damp washcloth, no? And when you clean it from inner to outer canthus. Inner to outer canthus. Okay? Pag discharge din, no, yung positioning niya is usually head of bed elevated 30 degrees or 2 pillows. No, pag discharge niya, head of bed elevated 30 degrees or 2 pillows. So yung side lying niya, post-op lang talaga yun siya, no? Post-op lang. Next, avoid increasing intraocular pressure. So na-mention na natin to, di ba? How to avoid to increase intraocular pressure. So sasabihin natin si patient na wag kakarga ng mabigat. Usually ang recommended nila, do not lift anything greater than 5 pounds. No? Don't lift anything greater than 5 pounds. Aside from that, do not bend, do not strain. So kung constipated, delikado yan pag nagsistrain, di ba? Do not strain, do not perform Valsalva maneuvers, ganyan. So wag mo na. And lastly, report any complications. So ano yung mga complications na ibig sabihin dito? No? If the patient starts to complain of severe eye pain, okay? Sabihin natin na 10 out of 10 or 8 out of 10, delikado yan siya because that could mean that it is infected or increasing intraocular pressure. Next, if the patient has vision loss, o delikado din, no? Because it actually takes 1 to 2 weeks for the vision to improve post-surgery. Okay? It takes 1 to 2 weeks for the vision to improve. So at first blurry yan siya, and then eventually magi-improve, and over time it will become better after 1 to 2 weeks. But if the patient complains of vision loss or nawala na talaga, it could mean na sira na yung nerves. So delikado yan siya. Next, if there is drainage, no, sa mata, and not just any drainage, kung yung drainage mabaho, may pus or purulent discharges, it could mean there is infection. Aside from that, if the patient keeps complaining of nausea and vomiting. So kung laging sumusuka, laging nahihilo, this could be a sign of increasing intraocular pressure. Okay? If the patient complains of itchiness, no, makate, that's normal. No, okay lang yan. It is expected na kakati talaga yung mata after surgery, no? Usually they report na parang may sand yung mata nila, no? Para silang napulingan ng sand. That's normal, that's expected. No need to report that. Okay? Ang ituturo mo lang sa kanila is to not scratch it. Huwag niyang kakamutin. Kasi the more niya is-scratch, the more magkaka-infect yung mata niya. Okay? Any questions? Any questions? No questions? Okay. True or false? Anticoagulant should not be given before surgery. Or anticoagulants are contraindicated before surgery. True or false? Pag sinabi kong contraindicated, anong ibig sabihin? Bawal daw ang anticoagulants. Answer is false. Okay? False. Hindi truly contraindicated ang anticoagulants. Diba? Sabi natin, if the patient who is taking warfarin, which is an anticoagulant, can maintain a PT of, ano yung PT niya dapat? 1.5, then they can proceed with their surgery. Okay, so kung 1.5 yung PT niya, hindi kailangan i-stop ang anticoagulant. Okay, pero kung hindi niya makontrol yung PT niya, sobrang taas, no? Or sobrang taas, ganyan, then they have to stop it. Okay, next. Kailan mo ba i-discontinue yung NSAIDs and ASA niya? Before surgery. Dapat 7 days, no? 1 week before surgery. Okay? True or false? Myotic drops are used 1 hour prior surgery. Myotic drops are used 1 hour prior surgery. True or false? Answer is false. No? Ano yung ginagamit natin? Myotic ba? It's your mydriatic. Diba may letter D doon? D means dilate. Mydriatic. Okay? After surgery, no? Ano yung positioning dapat ni patient? Kompletuhin nyo. Hindi lang side-lying yon. Side-lying, unaffected side. Side-lying, unaffected side. True or false, no? sa discharge ni patient. The patient should wear rigid eye shield 24 hours. Sa discharge ni patient. Sa discharge ni patient. Kailangan niya suotin yung rigid eye shield niya 24 hours. The answer is false. Okay? Kailan lang sinusuot yung eye shield ng 24 hours? Post-op lang. Post-op mo lang siya susuotin ng 24 hours. Pag discharge na siya, gabi mo na lang siya susuotin. Tapos pag umaga, sunglasses ka na. Tandaan ha, take note of the words. Pag sinabing discharge, hindi na 24 hours suot yung eye shield. Only at night. Okay? Pero post-op, for the first 24 hours, naka-rigid eye shield siya. Okay? How long niya susuotin yung eye shield niya pag discharge na siya? How long niya susuotin yung eye shield niya kapag discharge na siya? Dapat 1 to 4 weeks. Okay, 1 to 4 weeks. Okay? So, napansin ko na kunti lang yung nakakatama ng sagot. Ano ibig sabihin yan? Nakikinig pa ba kayo? Makinig na mabuti ha, kasi marami tayong mga tawag yan, kailangan alalanin, no? Pag sinabi mong discharge, iba yan sa post-op. Pag sinabing post-op, kay after ng surgery. Pag discharge, nakauwi ka na or pinapauwi ka na. Diba? Sinabi natin about sa anticoagulants, bawal, however, if their PT is contained to 1.5, they can continue surgery. Okay? Yung binibigay 1 hour prior is your mydriatics, not your myotics. Tignan mo lang yung word. Mydriatic, letter D, dilation. Okay? Any questions with cataracts before we continue? Any questions with cataracts before we continue? No questions with cataracts? Oh, last, true or false? Cataracts is painful. True or false? Cataracts is painful. False. Hindi siya painful. Okay, sige. Next na tayo. Ang next natin is retinal detachment. Okay. So, retinal detachment is the detachment of your retina. No? Most common cause, trauma. The most common cause is trauma. So, after a traumatic incident, pwede natamaan yung mata, no? Pwedeng mag-cause din siya. Aside from that, other causes would be aging, no? Ano pa? Diabetic. Mapapansin mo lahat ng condition dito, no? Lahat ng eye condition, meron talagang role ang diabetes, no? Aside from that, post-cataract surgery, no? So after cataract, pwedeng magkaroon ng tawag yan, retinal detachment. And lastly, genetics. Ano nga ulit yung mata na nakaka-cause ng retinal detachment? Or ito yung wina-watch out for natin? Ano nga yun? Yung mga pinanganak na may myopic eyes. Correct. Yung may mga myopic eyes. Yan. Okay? So, retinal detachment can be different types, no? You don't have to write this down kasi kahit anong type ng retinal detachment to, pare-parehas lang yung signs and symptoms niya. Meron tayong tinatawag na rhegmatogenous retinal detachment. Again, you don't have to write this down. They'll never ask this because it's too complicated. Okay? A rhegmatogenous retinal detachment is may butas yung retina. Okay? There's a hole inside your retina. Next, meron din tayong tinatawag na traction retinal detachment. Okay? A traction retinal detachment is that after an eye surgery, okay, or an eye injury, may scar tissue na bumuo. Yan. this scar tissue can start pulling on your retina. So this one is caused by scar tissue. Okay, post-surgery or post-injury, ganyan. Meron din tayong tinatawag na exudative retinal detachment. So in exudative retinal detachment, no, the area in your retina, nag-a-accumulate siya ng fluids dito. No, may pumapasok na fluid dyan. Okay? So usually, exudative retinal detachment is caused by as an injury, no, nasugatan, may bleeding doon sa loob ng retina. So either way, kahit anong type of retinal detachment pa yan, no, ang iyong assessment dito is that there is a change in their vision. So take note of the different changes, no? Patients can complain of shades or curtain, no? Parang may kortina na naka-cover sa kanilang mata. Tulad nito. Yan, para siyang may kortina daw. Cobwebs or flashing lights, tulad nito. Yan, tinatawag natin ito as cobwebs. Ito, flashing lights. Okay? Floaters. Yan, floaters or yung vision niya may mga black na mga floating devices, ganyan. Okay, floaters, they also call that as nuts. No? Nuts. Okay? And also it is painless. Now we have to watch out for sudden increase of floaters. Sudden increase of floaters sa vision would mean that there is bleeding in your retina. No? This means that there is bleeding in the retina. Okay? And without proper treatment, pwedeng mag-detach to siya totally and it will lead to blindness. No? Nakakabulag siya. Okay? So diagnostics natin, visual acuity test, okay, ophthalmoscopy, excuse me, ocular ultrasound para makita yung structure ng mata. Okay? Any questions with this one before we proceed? Any questions? No questions? Okay. So, the treatment for this one is surgery. No? Kailangan isi-surgery si patient. There are different types of surgery. Meron tayong scleral buckle. Scleral buckle is that with they will insert a clear silicone-like substance to compress the eye. Tulad nito, i-compress daw nila yung mata. No? So, they compress the eye for the retinal layer to adhere with each other. Okay, next, meron din tayong pneumatic retinopexy. In pneumatic retinopexy, they introduce a gas bubble or no, naglalagay sila ng silicone oil, pwede din liquid inside the eyes, no? Inside the vitreous chamber of your eyes. So ang ginagawa nitong bubble na to, tulad nito, no? How long yung scleral buckle? It depends on the doctor, no, kung gaano katagal. After they place this one, it usually heals 4 weeks. No? Kung severe talaga yung kanilang mga retinal detachment, pwede siya magiging more than 4 weeks, 6 weeks, ganyan. No? It depends on the severity of the eyes. No? Or gaano din kabilis mag-heal. For example, kung ang patient natin diabetic, matagal yan didikit. Okay? So next, no, they introduce a gas bubble, and this gas bubble, no, magi-inflate siya and it will push the retina back in place. Parang ganyan. So it acts as a tamponade, no? A tamponade. Next, meron din tayong photocoagulation, no? And photocoagulation, parang lang it's like welding the retina back in place, no? Parang welding. Okay? So they will use a laser to reconnect the retina back into their location. Okay? And there are other surgeries then. For example, kung meron kang traction retinal detachment, no, there is a fibrous tissue that is pulling there, then they will remove that fibrous tissue. So madami. Okay? So don't concern yourself kung ano yung surgery na ginamit. We're not gonna perform that anyway. However, what we are going to perform is yung before and after surgery. So before surgery, no, it's very important that the patient is in a quiet environment and they assume a proper position. So ano yung proper position nila? Their head should be neutral. So when you say neutral head, dapat straight lang. No? Hindi sila masyadong nag-flex or nag-extend ng kanilang ulo. The more they move their head, the more madidetach yung retina nila. So dapat neutral head lang. Tapos quiet. Okay? Next, their face is usually washed. No? Their face is usually washed with an antibiotic solution. Antibiotic solution. Okay? So, most common antibiotic solution, Cetaphil, no, ginagamit. Okay? But it depends kung ano yung gagamitin talaga nila. Next, before surgery, no, touching both eyes is not necessary. It is not necessary. However, if the patient is panicking, no, kasi for example, retinal detachment na ang nag-cause is trauma, no, biglaan, nabangga siya ng kotse, tapos nagka-retinal detachment siya. Nagpapanik yan sila, no? The more they panic, the more they start looking around kung asan-asan sila tumitingin, 'di ba? The more they move their eyes, the more magde-detach yung retina. So if they are panicking, they are anxious, it is best to patch both eyes to prevent the eyes from moving para hindi gagalaw yung mata nila. Next, after surgery, no, post-op position, magdedepende. No? Depende yan siya. If the patient was for pneumatic retinopexy, usually naka-prone to sila. No? Naka-prone sila. 1 to 2 days. Okay? Ang reason kung bakit natin sila pinoprone is to move the gas bubble, the silicone oil, the liquid, towards that area para doon dumikit. No? Kaya siya pinoprone. 1 to 2 days. If the patient is not, tawag yan, hindi siya pina-pneumatic retinopexy, the best position would be head of bed elevated 30 degrees or 2 pillows, no, to prevent any build of intraocular pressure. Aside from that, their face is also washed with an antibiotic solution. No? Post-op, dapat hindi nila gagalawin yung mata nila. Okay? That's why post-op, nakapatch din both eyes nila. And then tatanggalin yan siya eventually. No? After 1 to 2 or 1 to 3 days. Pag discharge nila, no, pag discharge nila, sasabihan natin sila na huwag mo na masyadong gamitin yung mata for any jerky eye movements. Okay? So can you tell me an activity where your eyes are moving quick? No, nagje-jerk yung mata nyo back and forth? Ano kaya mga activity na yan? Correct, reading, no? Pag nagbabasa ka, nagmo-move yung mata mo back and forth. No? Ano pa? Driving, of course, kasi delikado, di ba? Pag nag-drive ka, marami kang tinitignan. So reading, no, manonood ng TV, wag mo na, no? Give it a rest, no? Nood ng sports o nanood ka ng ping pong, ano yung mata mo? Pag ganun lang, nanood ka ng tennis, non-stop yung mata mo pag ganun lang. Okay, so avoid any jerky eye movements, TV, playing games, driving, etc. for 3 days, 3 weeks, for at least 3 weeks. Okay? Because the more you move your eyes, the more hindi mag-heal yung surgery. Okay? After 3 weeks, pwede na. No? Pwede na. Next, no lifting. Again, don't lift anything greater than 5 pounds and usually avoid lifting for 6 weeks. Yan, avoid lifting for 6 weeks. Okay? And also, no, avoid driving for 3 weeks din kasi pwedeng mabangga, etc. Okay? Any questions with retinal detachment? Any questions? No questions? Okay? Ano nga ulit yung Ano nga ulit ang positioning natin post-op sa retinal detachment kapag nagpa-pneumatic retinopexy sila? Post-op, kapag nagpa-pneumatic retinopexy, very good, prone. Kung hindi sila nagpa-pneumatic retinopexy, ano yung positioning nila? For any other retinal detachment surgery? Head of bed elevated, 30 degrees. May nag-answer ng mga neutral. Okay lang yan, head neutral. Is that after surgery or before surgery? The head should be neutral before surgery, not after. Okay, not after. Your patient had a retinal detachment on the right eye. Okay, how do you patch the eyes? Meron siyang retinal detachment on the right eye. How do you patch the eyes? Do you patch the right eye, left eye, or both eyes? Both eyes, no? Both eyes. Pag retinal detachment, both eyes are patched. And the reason for that, it's because when you move your right eye, you can also move your left eye. Unless pinanganak kang manok. Okay? Kung manok ka, siguro kaya mong magalaw yung mga mata mo. No? Pero kung hindi ka manok at tao ka, dapat isang mata. Yung isa, dapat both sila. Okay? Sino mga manok dito? No? Yung mata mo, dalawa. Para kang chameleon. Pag ganun-ganun yung mata mo. Okay? So, ganun ha. Both eyes dapat. Okay? Next. Discharge instruction tayo. How long sila pwedeng makabasa? How long silang pwedeng makabasa ulit? Discharge. After 3 weeks. Gaano kabigat yung pwede nilang kargahin para hindi mag-increase yung IOP nila? Not more than 5 pounds because greater than 5 pounds, pwede nang mag-increase yung IOP. And additionally, no, any conditions or any actions that increases IOP, bawal din sa retinal detachment. Okay? Sa cataract surgery, ano yung post-op nga ulit? Post-op position. Cataract surgery. Side lying, unaffected. Very good. Side lying, unaffected side. Okay? Sige. Let's continue with retinal detachment, and after retinal detachment, mag-dinner muna tayo. Okay, para isang malaking break na lang, no? Para hindi na tayo magmaliliit na break, no? Kasi nakakapagod 'yan, 'di ba? Magbubulag kayo, tapos magkakabalikan na naman, tapos hindi na talaga, ayoko na, tapos balik na naman. Diba, nakakapagod. So isang malaking break na lang tayo para mas fun siya, okay? Next natin, macular degeneration. And I always say this, no? Pag macular degeneration, this is easy. Madali lang to. Okay? Pinakamadali maintindihan si macular degeneration kasi wala siyang cure. Wala din siyang gamot, no? So, wala din siyang surgery. So, ang patient ito, mabubulag lang. So, wala masyadong mamememorize dito. Okay? So, macular degeneration, this is the loss of central vision. Loss of central vision. Meron tayong 2 types of macular degeneration, wet and dry. Okay, wet and dry. So pag-usapan muna natin si dry first. Okay, so draw tayo ng mata dyan. Yan. Okay, mata. So in a dry macular degeneration, no, yung macula natin starts to separate from our eyes. No, nagsa-separate siya. And the reason why it's separating kasi may umiipon dyan na lipids, taba, no? May umiipon dyan na lipids, tapos tumitigas. They call that as your drusen drusen ba yun? Yes, sorry, drusen formation. There is fats behind your macula. And eventually, yung taba na yan, mag-accumulate yan siya until yung entire macula mo is madedetach na talaga siya. Okay? That's why your dry MD or dry macular degeneration It's caused by drusen formation. This one is chronic. It is most common and it is chronic. So matagal siya. It takes a while para mag-develop ito. And then eventually, matatanggal siya. Okay? Cause nito is fat, no, lipids. Okay? It's most common and it's the most chronic. Next, wet MD naman tayo. Now sa wet MD, ang nangyayari dito is that there is, no, creation of new blood vessels in your eyes, no? May mga bagong blood vessels na nabubuo sa likod ng ating mata, no? We call this one as your neoangiogenesis or new creation of blood vessels, no? Neoangiogenesis. So pwede nating masabi na pwede siyang malignant, no? Kasi it's not supposed to be there pero may mga cells. Eventually, itong mga maliliit na capillaries na to, it starts to leak. Nagli-leak sila. Tapos nagli-leak sila behind your macula. Yan. That's why they call it as wet MD. Kasi may fluids na nabubuo dito. Okay? So, in wet MD, no, cause niya neoangiogenesis, this one is less common. So, it's rare. Okay? However, it is acute. So, mabilisan siya. Because it continues to leak to a point na madedetach na talaga yung mata, yung macula, which leads to blindness. Okay? Other risk factors, no, aging. No, as we age, pwedeng magkaroon ng ganito. Family history or genetics, race, no? This is more common among Caucasians. Okay? Smoking, aside from smoking, hypertension, DM, no? Ang DM, isa talaga yun sa mga risk factors sa lahat. No? Obesity at hyperlipidemia. Kasi di ba, na-mention natin yung dry MT caused by lipids. No? Hyperlipidemia. Or hypercholesterolemia. So, madaming cholesterol. Okay, so ito yung mga, ito yung mga risk factors ng macular degeneration. Assessment nito is the loss of central vision. Usually, ang ginagamit would be your Amsler grid. The Amsler grid. So, anong mukha ng Amsler grid? Yan. No? Yan yung mukha ng Amsler grid. Okay? So, there is different grid line patterns and meron siyang dot. Okay? And then eventually, now the patient will be taught how to use it. Kasi progressive siya, mapapansin ni patient that slowly nawawala yung dot or nagdi-distort yung dot. And then, that's how you determine the progression of macular degeneration. Macular degeneration has no cure. And eventually, it will lead to blindness na talaga. Madedetach to a point na wala na. Pati yung retina, na-detach na din. Okay, so anong nursing management natin dito? Instruct to use Amsler grid and supportive care na lang tayo. Supportive management. You might be asking, sir, what if palitan yung ating eyeballs, no, ng bagong eyeball? Well, it doesn't work that way kasi yung nerves, di ba, macula is the extension of your optic nerve. So yung optic nerve natin sa likod, affected na din. So hindi na, no, kahit papalitan yung eyeballs, hindi na din ganun ka-effective. Okay? So, any questions with macular degeneration? Ay, nakalimutan ko din pala ilagay. Frequent sun exposure. Frequent sun exposure. So, ibig sabihin, pag lagi kang nakatingin sa araw, no, nagsistaring contest ka sa sun, tapos gusto mo manalo, pwedeng masira yung macula mo at yung retina din, no? Sabay yan sila masisira. So frequent sun exposure can also cause macular degeneration. Okay? So any questions? Any questions? No questions? Okay, sige. Let's have a 20-minute break. dinner muna tayo, and after 20 minutes, we'll continue with glaucoma and the rest of the thing. Okay? Okay lang ba? Na walang reaction. So, patuloy na lang tayo. O sige, pwede din tayo magpatuloy na lang kasi, ayun, so may nagre-react na. Thank you, okay, haha. O sige. So yan, mag-react kayo kasi kung walang magre-react, magpapatuloy lang ako. Okay, so 20-minute dinner break. O, pwede din, bladder break na din. So, basta wag nyo lang dadalhin yung pagkain sa CR. No? Separate dapat yan. CR muna kayo, then kain. Okay, so I'll see you back after 20 minutes. Okay? Okay, let's continue. Okay, ang next natin is glaucoma. No? Glaucoma, it is caused by increased intraocular pressure, and this intraocular pressure directly damages the retina, the macula, and eventually the optic nerves. Okay? And because of this compression, this pressure does, no, the patient will eventually become blind. No? Nabubulag sila eventually. Okay? So meron tayong two types of glaucoma. Meron tayong chronic or open angle glaucoma. Meron din tayong acute or closed angle glaucoma. So anong difference nila? No? Pag sinabi nating open angle glaucoma, when you look at the anterior chamber, no, as you can see, there is an angle. Yan, open yung angle niya. No? And because the angle is open, ibig sabihin, the aqueous humor is able to, no, move accordingly and drain in the trabecular meshwork. So in a patient with chronic or open angle glaucoma, their problem is the trabecular meshwork. No, the drainage system is not functioning properly. Ibig sabihin, either barado siya, there's a tissue that has grown over there na hindi nawawala, ganyan. Ang closed angle naman, if you look at their aqueous, either anterior chamber, there is no angle. No? The angle is missing. Kaya siya tinawag na closed angle glaucoma. That's why the fluid that was created by the ciliary body cannot drain properly. No? Hindi siya nakakalabas and nakaka-drain. It's just stuck there. So the pressure just increases. Okay? Close angle glaucoma is considered a medical emergency. Okay? Medical emergency kasi mabilis mag-progress to blindness. Okay? So, let's talk about your chronic or open angle glaucoma. First, ano nangyayari dito? There is pain. There's pain. But the pain here is different sa acute. No? The pain here is usually mild, no, and bilateral. So it means na yung both mata ang naapektuhan. The pain is usually mild and bilateral. The vision change is tunnel vision. They usually complain of tunnel vision. Later, I'll show you what a tunnel vision looks like. And also, they complain that there is difficulty in dark rooms kasi nawawala yung kanilang peripheral vision. No? Missing peripheral vision. Okay. Medications nila, meet. No? Lahat ng mga gamot na to, in general, they just decrease intraocular pressure. So let's meet them one by one. Okay? So M is your myotic eye drops. Myotic eye drops. Okay, myotic eye drops, ang ginagawa nito is that it constricts the pupils because when you constrict the pupil, it decreases intraocular pressure. Pag nagda-dilate yung pupil natin, it increases IOP. Okay, next. E is for epinephrine. Okay, your epinephrine, its main function is that it tells the ciliary bodies, itong mga ciliary body dito, to stop producing aqueous humor kasi kinoconstrict niya. When it tells them to stop producing aqueous humor, it decreases intraocular pressure. Okay, next. Si acetazolamide, ang A. Acetazolamide. Okay, acetazolamide or Diamox, yung other name niya. This medication acidifies the body. No? It increases the acidity in your body. So as a response, ang ginagawa ng ating katawan is to eliminate excess acid through urination. So ang ginagawa nito is that it makes the patient, no, urinate, tumataas yung UO. And as the patient urinates, intraocular pressure decreases. Okay? And lastly, si T, timolol. No, timolol eye drops. Now, timolol eye drops, binibigay din to siya to decrease production of aqueous humor and to decrease intraocular pressure. So, lahat ng mga gamot na to, myotic eye drops, epinephrine, acetazolamide, and timolol, they all decrease intraocular pressure. For surgeries, usually ang mga surgery na ginagawa dito is filtering procedures. So what are filtering procedure? Gumagawa sila ng bagong drainage system. No? They create a new drainage system. Aside from that, laser trabeculoplasty. So they repair the trabecular meshwork. Kung asa nagde-drain yung fluid, they repair that. Okay? So that's for your open angle glaucoma. For your close angle glaucoma, no? Meron din tayong pain. The pain is severe and unilateral. So isang mata ang naapektuhan. It is severe and unilateral. Vision change, usually ang vision nito is it starts to become blurry, no? Steamy. Sinasabi nila steamy, pero later on it progresses to a tunnel vision. Aside from that, they have also profuse lacrimation or tulo ng tulo yung mga luha nila because the fluids inside their eyes are trying to escape. And because walang other way to escape, they escape via the tear duct. So that's why profuse lacrimation. Medications dito is, again, meat pa rin. No? Myotic eye drops, epinephrine, acetazolamide, and timolol. Pero hinaluan sila ng osmotic diuresis tulad ng mannitol. Mannitol, di ba? It increases ICP but it can also decreases ICP but it can also decrease IOP. So binibigay ito sila during emergency. And narcotic analgesics tulad ng morphine because the pain caused by your closed angle glaucoma can be severe. Sobrang sakit. So morphine yung mabibigay. Now for surgery, argon laser beam surgery. So this one, argon laser beam surgery is that they try to open the angle using laser. No? Ibig sabihin, they will try to fry this area using a laser para may angle konti. Any question with your glaucoma? No questions? Okay, let's continue. So in general, no, ito yung na-assess natin sa glaucoma. They complain, no, sa start, initially, they complain of blurred vision or halos around light. Okay? Aside from that, meron din silang headache. And the headache is usually because of increasing IOP. No? The headache is worse, especially kapag acute glaucoma. And lastly, the loss of peripheral vision or yung tinatawag nating tunnel vision. So as you can see, ito yung tunnel vision. So para talaga silang, no, at the end of the tunnel may bright light. Parang ganun tignan. Okay? Kung wala kayong nakitang tunnel vision sa question, ang next yung hanapin is gun barrel vision. No? Gun barrel vision. It's the same as tunnel vision. So diagnosis, tonometry to measure the increase in intraocular pressure. Usually may napapansin silang greater than 50 millimeter mercury increase. Next, ophthalmoscopy, they check the optic nerve. And when they check the optic nerve, they would usually see that the optic nerve is narrow yung mga blood vessels. Narrowed blood vessel means that there is too much pressure for the blood vessel. So tulad nito, narrow na yung mga blood vessels niya. Next, gonioscopy. Gonioscopy, they try to determine if there is a presence of an angle in your anterior chamber. Okay, so they can determine if it is closed angle or open angle. Perimetry is an assessment for visual field assessment. It's a visual field assessment for your peripheral visual field assessment. Okay, management nito, no, for pharmacologics, ang tatandaan natin, this one is a lifetime management or a lifelong management to control IOP, increase IOP. So mga gamot natin dito is number 1, beta blockers, yung timolol na na-mention natin, timolol eye drops. Now, this one is to decrease IOP. At the same time, ang side effect nito is that it increases eyelash growth. No? Pinapahaba niya yung mga eyelashes. So ang ating dyan, ang ating nursing intervention is to trim it. Kailangan tinitrim natin yung eyelash. Next, myotic eye drops. No? This one decreases or it constricts the pupils. No? to decrease intraocular pressure. Okay? Adrenergic agonists, alpha-2 agonists, no, these medications are stimulants tulad ng epinephrine. No, ang ginagawa ng mga gamot na to, best example natin is epinephrine. They tell the aqueous humor to stop producing, no, to stop producing, tawag yan, fluids. Okay? So walang na-produce na fluids sa aqueous humor, so walang tumataas na IOP. Ganyan. Okay? So yan yung mga gamot natin. Any questions? Any questions before we proceed? No questions? Okay, so let's talk about the surgery. No? So there are different types of surgery para sa patient na to. Yung laser trabeculoplasty, no, yung tinirepair nila yung ating, tawag yan, nire-repair nila yung ating trabecular meshwork, usually for open angle. Laser iridotomy, this one is a treatment for acute glaucoma, no? Kasi they will cut a hole in your iris para dyan magdi-drain yung fluid, no? Para may madadaanan yung fluid. So this one is actually not permanent repair, pero parang ano lang siya, no? Temporary, no? Especially to decrease the intraocular pressure as fast as possible. Filtering procedure, trabeculostomy, this one is they create artificial openings. So, gumagawa sila ng mga artificial opening. Tulad ng ating argon laser beam. Yung argon laser beam, ito, bubutasan nila yung area na yan para kung walang angle dito, dito na lang mag-drain. Okay? And lastly, drainage implants or mga implant shot. No, they create new drainage areas or they place an implant on that para doon nadadaan yung mga fluids. Okay? For all of these surgeries, no, tatandaan natin that this is not a permanent treatment for glaucoma and eventually, magpo-progress pa rin siya to blindness. Okay? Hindi to siya permanent treatment to glaucoma. It will still eventually lead to blindness. That's why the interventions in glaucoma is to decrease the progress para pabagalin nila. So anong mga nursing management natin? No? Health education. They have to know that it is a lifetime condition and they have to follow medications, no? Change lifestyle, change diet para hindi to siya mag-progress. Next, ensure safety because they have visual impairments, no? Impairments, so dapat they are assisted as much as possible. Also, advise relatives to undergo glaucoma exam every 2 years because this can be inherited. Lalong-lalo na yung chronic glaucoma. Inherited yan siya. And also, as much as possible, avoid increased IOP. Avoid straining, no? Avoid being constipated, avoid coughing. So, dapat yung kanilang vaccines up to date para hindi sila magkakaroon ng upper respiratory problems. As much as possible, hindi dapat sila magsisigarilyo. Avoid vomiting, avoid lifting, ganyan. So as much as possible, we try to control the intraocular pressure based on their lifestyle. Okay? So any questions with glaucoma? Any questions with glaucoma? No questions? Okay. Sige, let's try answering the following. Okay. Your patient, post-op, pinosisyon siya ng prone. Ano kaya yung kanyang sakit? 1, 2, 3, or 4? Post-op position niya is prone. Ano kaya yung kanyang sakit? 1, 2, 3, or 4? Answer is
Number 1, correct. Number 1 ang answer natin. Ang patient natin, pinosisyon siya side-lying, unaffected side. Ano kaya yung sakit niya dyan? 1, 2, 3, or 4? One, two, three, or 4. Answer is number 4. Okay? Your patient was taught to use the Amsler grid. Anong sakit niya? 1, 2, 3, or 4? Sinabihan siya paano gumamit ng Amsler grid. 1, 2, 3, or 4? Answer is number 2. This is the only tawag yan, the only eye disorder na na-discuss natin na painful. Okay, 1, 2, 3, or 4? Na-discuss natin na may pain. Sino? Number 3. Sige nga, pangalanan natin sila. Si number 1, sino kaya to? Anong eye disorder yan? Retinal detachment. Kasi meron kang curtains, di ba? Meron kang floaters. Very good. It's your retinal detachment. Si number 2, ano to? That's your macular degeneration. Kasi meron kang central vision loss. Very good. Si number 3, ano kaya to? Glaucoma. Kasi meron kang tunnel vision. Correct. Tunnel vision. O si number 4, sino yan? So na-discuss nating 4. Wala nang iba. It would be your cataract. Okay? Cataract. Okay, very good. Sige, let's continue answering. A patient reports sudden visual impairment following a contact sport-related trauma. According to the patient, after being punched in the right eye, sudden white flashing of lights appeared. Patient further stated that this was not new as he has experienced this before. However, even after 2 hours from his training, white flashes of light as well as black spots in his peripheral vision continues to appear. Patient further stated that images also appear to be blurry. On assessment, right periorbital area appears to be swollen with 1-inch red-purple ecchymosis noted on the lower eyelid. Pain scale is 4 out of 10 but increases when palpated to 6 out of 10. The nurse reviews the client finding and has findings as potentially blank as evidenced by blank. So based on your assessment, what do you think is the client experiencing? Meron tayong flashing of lights. No? Ano pa? White flashes, black spots. Okay, that's your correct. Retinal detachment. Number 3. Anong evidence natin na meron siyang retinal detachment? Answer is number 3 pa rin. Flashing of lights. Okay, very good. Okay, next tayo. A 50-year-old client visits the EENT clinic complaining of diminishing central vision. Client is diagnosed with type 2 DM, secondary hypertension, and hypothyroidism. Client is currently taking metformin, levothyroxine, and most recently atorvastatin due to new onset dyslipidemia. Client is also an avid smoker, smoking at least 1.5 pack per day. Client's occupation is an electrical lineman. Client spent most of his working days out in the sun on top of electrical poles. According to client, he experienced bouts of headache and eye pain. The headache was pre-occipital in location and was aggravated when working during the day. The client's eye pain progressively worsened, especially when working outside. However, the pain as well as the headache would palliate at night when the client is at home or when the client is asleep. For each finding, specify whether the finding is related or not related to the chief complaint. Question, what is the client's chief complaint? Anong chief complaint ni client? Client was complaining of diminishing central vision. Diba? So, Diminishing central vision could be related to your macular degeneration. Okay, sige. Ito yung mga findings niya. Type 2 DM. Is this related or not related sa kanyang chief complaint? Related. Very good. Hypertension. Related or not related? Related din, yes. Thyroid medication. Yung kanyang levothyroxine. Is it related or not related? Kanyang thyroid medications. Is it related or not related? It is. It is related, no? It is related. Levothyroxine can cause macular degeneration kasi kaya niyang i-constrict yung mga pupils sa mata ni patient. It is related. Okay, next, dyslipidemia. Related or not related? Related. Cigarette smoking. Related or not related? Yes. Headache. Related or not related? Meron bang headache ang macular degeneration? It is not related. Ano nga lang ang only na-discuss natin na may pain? Glaucoma lang. Glaucoma lang. O, sige. Eye pain. Related or not related? Is not related. Metformin use. Paggamit daw niya ng metformin. Is it related to MD or not related? It is not related. Okay? So, ang answer natin, the risk factors would be type 2 DM, hypertension, mga levothyroxine, dyslipidemia, cigarette smoking lang. Okay? So, these are the risk factors of macular degeneration. Okay? Let's continue. A 45-year-old client hospitalized after complaining of sudden vision loss in the left eye. Client is afraid and anxious, complaining of chronic headache, balance problems, nausea prior to vision loss. Additionally, client did not notice total vision loss on the affected eye until a towel draped his right vision. So, ibig sabihin, hindi niya pala alam, bulag na siya until na-cover yung kanyang right eye. Na-cover yung kanyang right eye. Client did not understand how this started or what caused the condition. Vital signs as follows: temperature is 36, RR 23, pulse rate 110, BP 140/90. Okay? Physical assessment. On assessment, client shows loss of depth perception and peripheral vision on the left eye. Client also complains of headache associated with eye pain, that is 6 out of 10. With the working diagnosis of glaucoma, select the intervention that would be appropriate for the nursing diagnosis. Each nursing diagnosis may support more than one answer. So meron tayong tatlong nursing diagnosis dito. Each nursing diagnosis is specified under per option. So diagnosis 1 would be your option 1. Diagnosis 2 would be option 2, and diagnosis 3 for option 3 lang. Okay? So, disturbed sensory perception, option 1. Okay, first, arrange patient's environment in accordance to SO to manage visual limitation. Is this a potential nursing intervention? Yes or no? Arrange the patient's environment in accordance to SO to manage visual limitation. Answer is no, kasi yung word na SO dapat kay patient. Hindi pa totally blind si patient, ha? So, hindi siya pwede. Okay, next. Administer NSAIDs to treat headache. Pwede ba? Yes. No? Ibuprofen can be given for patients na may headache, okay, na caused by glaucoma. Okay lang yan. Administer pressure-lowering eye drops. Okay. Pwede ba? Pwede, no? That's one of their drug of choices. Anticipate mannitol to control ICP. Is this correct? See number 4. The answer is no. Correct. Kasi dapat IOP, not ICP. Okay, next. Anxiety naman tayo. Allow expression of the feelings about loss of vision. Is this correct? Yes. Identify helpful professionals such as an optician. Is this correct? This is wrong, no? Because an optician does not, ang ginagawa ng optician, sila yung nagpa-file or nag-grind ng mga lenses, no? In accordance sa prescription. So, mali siya. Reinforce to the client that a condition is temporary. Mali din. This one is lifetime. Okay? Apply physical restraints to avoid agitation. Mali din. Because when you restrain a patient and they strain away from that restraint, pwedeng mag-increase yung IOP nila. Okay, next. Option 3 tayo. Refer the client to an optometrist for possible surgical interventions. This one is also incorrect. No? This is the incorrect professional kasi dapat ophthalmologist yung nagsisurgery. Stress the importance of glaucoma screening for family members. Yes. Instruct to decrease roughage in diet. This one is incorrect because when you say decrease roughage, di ba, that's another way of saying low fiber. So mali siya. Avoid exercising as this can increase IOP. Is this correct? Avoid exercising as this can increase IOP. This one is wrong, no? Pwede pa rin mag-exercise si patient. But there are certain limitations to their exercises na hindi na silang pwedeng magkarga ng mga mabibigat. So, avoid lifting or mga resistance exercise. But, pwede pa sila mag-walking, no? Ano pa? Swimming, ganyan. So, the answer here is yan. For disturbed sensory perception, 2 and 3. For anxiety, 1. For deficient knowledge is number 2. Okay, let's continue. A client is diagnosed with cataracts and was indicated for extracapsular cataract extraction without lens implant. Okay, the client was like, so ilagay na lang natin dito, no? Right eye, yung kanyang inoperahan. Right eye. Okay, so let's see if the topics, the health education is indicated for the 3 topics. Okay, first, for pre-operation, no? Instruct to avoid NSAIDs prior surgery. Tama ba yan? For pre-op natin na health ed, this is correct. Advise patient to discontinue warfarin maintenance. This one is wrong. No, they can continue it as long as control yung kanilang PT. Administer myotic drops as indicated. Also wrong kasi mydriatic yung binibigay. Inform the client the need of SO to assist client post-surgery. This one is correct because the client has a visual problem. So, kailangan niya ng konting assistance. Okay, post-op tayo. Position the client left side lying. Very good. This is correct. Kasi the operated part is the right eye. Administer acetaminophen pain medications. Yes, tama. Clean the eye using a dry washcloth from inner to outer canthus. Dapat damp. No, masakit yan. Apply the rigid eye shield every night. Meron kayang mahuhuli dito? Op, pre-op, ay post-op. So every night ba? Pag post-op? No, dapat 24 hours. Okay? Ang every night is kapag na-discharge na sila. Okay? So yun, no? Take note kung ano yung hinahanap. Okay, next, discharge instruction. Recommend watching TV for recreation o magti-TV na daw agad. wag mo na, no? Allow the patient to rest. Instruct the client to remain in bed for 3 days. Take note, discharge na to ha? Hindi na, okay? 3 days is for post-op. 1 to 3 days. Post-op lang yan. Allow him to walk upstairs only with assistance. Only with assistance. Meron tayong limiting word dito, only. So, ibig sabihin, hindi siya makakaakyat ng stairs kung walang assistance. What do you think? Answer is yes, kasi wala na siyang lens. And kung wala na siyang lens, hindi niya na magigauge yung distance ng mga stairs, pababa or pataas ba yan. So, kailangan may assistance na siya. Increase oral fluid and fiber in the diet. This one is also yes. Okay? Tama din to siya. To avoid any constipation. Okay, last, before tayo mag-ears, an 18-year-old client rushed the ED after a head-to-head collision with another football player during a sporting event. Client fainted after said collision and woke up after 1 minute. Upon waking up, the client complained of headache and bleeding on the mouth. On assessment, no overt head wound, swelling, or bruising was observed. However, client bit his lip during collision, which caused a bleeding. 9:30, client stated vision started becoming blurry. Resident ED physician notified. At 9:35, client observed to be anxious. Client exclaimed loss of peripheral vision on the right eye, stating, "It's like half of my vision is shrouded." At 10 o'clock, client is diaphoretic, listless, and anxious. Client complained of sudden dark spots appearing on his visual field. Complete the diagram by dragging from the choices below. One potential condition, two actions the nurse would take to address the condition, and two parameters the nurse would monitor to assess the progress. What is the potential condition the patient is experiencing? Ano kaya yung potential condition niya? It's your retinal detachment. Very good. Letter D. So what action should we take knowing meron siyang retinal detachment? No, knowing na meron siyang possible retinal detachment. Anong answer? Dapat dalawa daw na actions. No, dapat letter D, prepare for immediate surgery because if there is sudden dark spots, it means that there is bleeding sa retina. And ano next? And letter E, correct. No, patch the both eyes to prevent from one eye from moving. So dapat both eyes naka-close na. Letter A is incorrect because visual acuity test is part of your secondary assessment. And secondary assessment is only done once the patient is stable. Hindi stable si patient. Letter B is incorrect because Amsler grid test is indicated for macular degeneration. And letter C is also incorrect because applying a rigid eye patch is used for cataract surgery post-op. Okay, so what would be our monitoring to assess the client's progress? Ano yung imo-monitor natin dito? To determine the progress of the client. Best answer would be visual acuity para ma-determine natin if the eyes are still functioning properly, and letter A, vital signs. No? Hindi mo na kailangan mag-pain assessment because you're trying to monitor the functionality of the eye, yung kanyang retina, if it's still working. So vital signs would be enough. Okay? So any questions before we proceed to our ears? Yung nauna, yung pinaka-first. Before yung last. Okay? So, any questions? Tapos na tayo sa eyes natin. We will now be proceeding sa ating ears. So, sa ating ears, no? Tatlo lang yung ating papag-usapan na disorder. Otitis media, deafness, at saka Meniere's. Kasi yun naman yung common na tinatanong or yung paulit-ulit. Okay? So, let's start with a little anatomy and physiology of our ears. Okay? Our ears are separated into three parts. Meron tayong external ear, middle ear, and then internal ear or inner ear. Your external ear, no, its main function is to direct sound. No, it collects sound and direct it to your ear canal. So it is for collection of sound, no, and it directs it towards the ear canal. So passage of sound din siya. Passage. So ang mga parts ng ating external ear, no, would be your auricles, yung little curvature sa ating ears. Main function nito is to collect or direct sound towards your ear canal. So dalawa lang yung importante dito, no? The auricles and the external ear canal. Now, in the middle ear, no, it starts from your tympanic membrane or your eardrum and it will end in your stapes, yung mga bones natin. Its main function, itong middle ear natin, is that it transforms sound, no, sound wave, yung na-collect na sound wave, into mechanical vibration. Okay? So yung mga na-collect na sound wave kanina sa ating auricles, external canal, they will now start to vibrate the eardrum. As the eardrums vibrate, your malleus, your incus, and stapes, yung mga ossicles natin, also vibrates. Okay? So ang ginagawa nito, it transforms sound wave to mechanical vibration. Now in your inner ear, no, its main function is hearing, no? Hearing. So ang ginagawa niya is that it transforms mechanical vibration into electrical conduction. Okay? Electrical conduction. So yung nagba-vibrate kanina, gagawin niya lang electrical conduction para magiging siyang neural activity para ibato sa cranial nerve 8 natin. Yun yung ating auditory nerve. Aside from actually hearing it, no, ang ginagawa din ng ating inner ear is for equilibrium and balance. No, equilibrium and balance. No? So it tells us our orientation within space. Kung alam niya ba kung upside down tayo, nakaupo tayo, nakatayo, or nakaharap, ganyan. Okay? So a very simple understanding of your ears. No? Any question with this one? Any questions? No questions? Okay, let's continue on ear assessment. Ayan. So, in assessment, we can perform inspection and palpation. By inspecting, no, by looking at your ears, you can determine if there are already problems. For example, kung may drainage yung ears niya. No, kung may drainage yung ears, ibig sabihin baka may infection. If the external ear is affected, for example, meron siyang otitis externa, ibig sabihin yung kanyang ear, no, is inflamed. No? Kung inflamed yung ears niya, ibig sabihin, sound wave cannot be collected. Aside from that, we can also palpate to determine if there are any problems. No? For example, when you palpate the tragus, okay, the tragus is, for example, ito yung ear natin. No? Tapos parang may ganun siya, di ba? And that's the tragus. If you palpate the tragus and it's painful, masakit siya, it is usually indicative of otitis media. Yan. Additionally, if your ears are, tawag yan, parang naka-forward siya, if it's facing forward, it could mean that the mastoid bone is inflamed. So baka nagkaroon ng mastoiditis. So yan. So just inspecting the ear, palpating the ear, we can determine different problems na. Next, otoscopic exam, no? So this is the use of an otoscope to view the eardrum. Titignan natin yung eardrum. Our eardrum is usually light gray or pearl gray in color. Yan yung normal color ng eardrum. Okay? Pearl gray. Any discoloration usually reveals an underlying problem. Okay? Kung pumupula siya, tapos may lumalabas siyang drainage, then otitis media yon. Now, ano yung mga nursing consideration natin kapag nag-otoscopic exam? First, dapat yung mga kamay natin malinis. No? Malinis yung kamay. Second, the room should be dark. Third, you have to straighten the ear canal. Di ba? You have to straighten the ear canal. And you already know how to do this. No? Kung ang patient nyo is less than 3 years old, how would you straighten the ear canal? If your patient is less than 3 years old, how do you straighten the ear canal? You pull the pinna back and down. Back and down. And kapag greater than 3 years old siya, you pull the pinna back and up. So ganun. That's how you straighten the ear canal. Once you have straightened the ear canal, you can now use the otoscope. Now, when you're using the otoscope, remember that you should not put it inside the bony interior. No, don't place in the bony interior of your ear. Kasi medyo masakit yan. No? Masakit. So what is the bony interior? Ayan. No? So as you can see, that's the otoscope. And tignan mo kung asan siya nag-end. It's near the bony interior lang. No? Hindi siya lumampas. Because it can be painful. Aside from that, no, for pediatric clients, mga pedia patients natin, otoscopic exam should be done last. Done last because this is considered as an invasive procedure. No? So dapat last na siya gagawin. Okay, next, gross auditory activity. Now, this one is just a general assessment for hearing acuity. No? So, ang ginagawa dito, one of it would be your whisper test. Okay? So, pag nag-whisper test ka, you tell the patient to close the ears that is not being tested. For example, ang tinetest mo is yung right ear niya, so close niya yung left, parang ganito. No? And then, you stand 1 to 2 feet away and tell the patient to look forward. Nakatingin lang siya forward. And then you cover your mouth, and then you whisper something. After that, you go to your patient, and then you ask them, what did I say? O, ganun lang. That would be your whisper test, a gross auditory test. Okay? It does not determine any problem. It just determines if the hearing can be heard. Okay, next, we have your Weber and Rhine test. Now, this one is with the use of a tuning fork. Tulad nito, ang mga tuning fork natin. Weber test is used to determine lateralization of hearing. So how to conduct this? You strike the tuning fork somewhere hard, it starts to ring, you put it at the middle of their head. Okay? Normally, ang normal nito, they have to hear it on both sides of the ears. Both side of the ears. Naririnig dapat niya on both sides. Okay? If the patient hears it longer on one side, if the patient hears it longer on one side, it could mean that the patient has sensorineural or conductive hearing loss. Sensorineural or conductive hearing loss. Later we will talk about it. So as you can see, it does not really determine or diagnose hearing loss properly. Kasi assessment tool lang siya. If you can hear it on one side longer, it could be sensorineural or it could be conductive. Next, for Rhine test naman. Now, Rhine test can determine the hearing loss. However, it cannot diagnose. Tandaan ha, it can only assess. So, paano to ginagawa? Okay, so again, with the tuning fork, you strike it in a surface and then you put it near the patient's ear. Papakinggan niya. Okay, you time it. And then afterwards, once the patient says, I can't hear anything anymore, you put it at their mastoid bone, sa likod. Idikit mo doon. And then, papakinggan niya, tapos Tawag yan. Time it, and then you tell the patient to tell you kung hindi niya naririnig. No? Kung hindi niya naririnig, stop the time. Okay? So with a Rhine test, it actually determines if there is possible conductive or sensory neural hearing loss. Okay? Ang normal kasi dapat, or a positive Rhine test, the air conduction should be heard longer. Yung air conduction, that is the one when you strike the fork and you put it near the patient's ear. It should be heard longer. Now, abnormal yan siya if you hear bone conduction longer than air conduction. It could mean that you have a conductive, tawag yan, a conductive hearing loss. If we hear bone conduction longer than air conduction. Later, we will discuss ano tong mga sensory neural and conductive hearing loss. Anong difference nila? Okay? Any questions with this assessment? Any questions with assessment? No questions? Okay, let's continue. Now, these are diagnostic tools that can be done by doctors. Now, audiometry, now this one, it can determine between sensory neural, no, and conductive hearing loss. Ito na talaga yung qualitative test or a precise test for determining a type of hearing loss. Next, tympanogram. Tympanogram is used to detect any middle ear disease. Any middle ear disease. Middle ear endoscopy, it's an endoscope for your middle ear. Okay? So viewing siya, no? It's a viewing diagnostic test para makita yung endoscope, ay makita yung middle ear. Auditory brain response naman, this is where they put an earbud, for example, dyan sa baby, and then they emit a sound. Okay? After they emit a sound, they look at the brain waves and determine if the brain has detected that sound. Okay, so that's your auditory brain response. Sorry. It is safe and painless. Okay, and it just determines if the nerves are working. It determines if your nerves are working properly. Okay, and the last, itong electronystagmography and platform posturography, both of this just diagnose if you have balance or equilibrium problem. If you are unable to maintain proper balance. Okay, any question? No questions? So parang walang mga tanong. Okay, let's answer this one. During a hearing assessment, the nurse notes that the sound lateralizes to the client's left ear with the Weber test. The nurse analyzes this result as number 1, a normal finding. Number 2, conductive hearing loss. 3, sensory or conductive. Or number 4, presence of nystagmus. Answer natin is number 3. No? It could be sensory neural or it could be conductive. It is not a diagnostic tool, so it is not accurate in determining. Okay? So let's talk about the different types of hearing loss. Okay? When it comes to hearing loss, meron tayong 2 types, conductive and sensory neural. Best way to remember this, kapag conductive hearing loss niyan, no, the affected part is the external ear and the middle ear. Okay? So ibig sabihin, no, the sound wave collection is affected or the vibration is affected. So ganun lang. It's the fastest way of determining it. No? If your tympanic membrane, the different ossicles are not vibrating properly, then meron kang conductive hearing loss. if there is no sound waves being directed into the external ear canal, ibig sabihin may barado, no? Impacted siya with cerumen, etc. Conductive hearing loss agad yan. Now, sa sensory neural natin, mabilis lang din to because in sensory neural, the damaged part is the inner ear. Okay? Ang problema nito is that there is damage to the nerves or nerve damage. Okay? Between conductive and sensory neural, ang conductive, no, pwede pang ma-fix ng surgery. No? It can still be fixed with surgery with minimal, no, with minimal permanent hearing loss. Whereas ang sensory neural, okay, it can be fixed with surgery, but it almost always leads to permanent hearing loss. Okay? So ang sensory neural can still be fixed by surgery, but surgery can lead to hearing loss, permanent hearing loss. Whereas ang conductive, it can be fixed by surgery and it is usually minimal lang yung damage na makakause ng permanent hearing loss. Additionally, ang sensory neural, if it's caused by a disease, tatandaan mo lang yung 3 M's. These are the diseases that can cause sensory neural. Meniere's, okay, mellitus, so diabetic mellitus, and mixed edema. Ito yung nakaka-cause ng sensory neural hearing loss. Okay? Any questions with conductive and sensory neural? Any questions with conductive or sensory neural? No questions? Okay, let's continue. So ano yung pwede nating interventions dito? No? Patients can use hearing aids. However, we have to remember that hearing aids can only be used if there is conductive hearing loss. It cannot be used with sensory neural. Old age, no, yung presbyopia, yung tinatawag natin presbyopia, ay presbycusis pala. Presbycusis or the loss of auditory acuity with age, that is sensory neural. Hindi siya conductive. Okay? So hearing aids can only be used by those who have conductive hearing loss. So ano yung ating mga nursing intervention dito? Number 1, it should be at the lowest setting. No? Pag hindi pa siya sinusuot, lowest setting, and you adjust the volume as necessary, pinapataasan. Next, concentrate on the sound that wants to be heard. This one filters the noise. Meron din tayong proper cleaning. The mold should be cleaned with soap and water. Mild soap and water. This is the mold. Yan. Yung parang silicone. Okay? Whereas the plastic should be white. Ito. White lang to. Both of them should not be submerged in water. Huwag dapat isa-submerge sa tubig. Now, what if merong mga, collection doon sa mold, no? May mga earwax. Pwede din yung linisan. You can use a toothpick or a pipe cleaner. May mga maliliit na pipe cleaner to clean the ear cannula. Okay? Aside from that, mga other nursing intervention natin is that we tell them to turn it off when not in use. We turn it off when not in use para to conserve battery. Okay? And also dapat, they also have to have it by themselves at all times. No, wag iiwanan. Don't leave at home. Leave at home. Okay, ganyan. Now, other nursing interventions natin for decreased auditory acuity is approach the client. Approach the client and visibly gain the attention. Okay? Approach the client and visibly gain the attention. Next, position yourself in front of the client during communication. Speak directly facing the client. This will allow the client to read your mouth, your lips, kung kaya niya. The next, sign language. If the patient knows sign language, pwede niya gamitin. Question, what if yung anak niya ang nagta-translate? Pwede ba yan? Can the child translate for the patient kung nagsa-sign language? Answer, pwede ba yung anak ang mag-translate? No? Answer is no. Dapat kumuha ka ng professional translator. No? Kasi, if the patient says something and yung anak niya ayaw niyang sabihin sa iyo yun, ayaw niyang, gusto niyang i-construe yung sinasabi ng pasyente, di pwede niyang gawin yun. So, hindi mo malalaman yung truth. But if there is a third-party translator, they don't care. Ang kanilang lang is i-translate lang talaga, makukuha mo yung totoong sinasabi ng patient. So, dapat professional translator lang tayo. Next, tone and volume of the voice. Tatandaan natin, we have to speak in a low tone and decrease the volume of your voice. The higher the volume, creates a higher tone, it creates a higher pitch. And the higher the pitch, the more difficult to determine what you are saying. But the more mo pinapataasan yung voice mo, yung pitch mo, the more hindi siya naiintindihan. Pakinggan mo si Ariana Grande. Yan ang best example ko. Maintindihan mo yung mga kanta niya. Pag nandun na siya na part, di ba? Wala ka nang naiintindihan. Okay? Next, hearing aids should be in place at all times. Huwag tatanggal-tanggalin. And if the patient is hearing impaired, put a hearing impairment sign on the door. Gagamitin natin yung mga patient communicating devices natin. For example, may hearing impairment doon, you can put that one. Para malaman ng mga other nursing professionals. Okay? Any questions with this one? Any questions with this one? No questions? Okay, let's continue. Next disease natin is otitis media. Okay? Sir, bakit hindi natin dinidiscuss yung otitis externa? Because otitis externa is not a very common disease. Common siya among swimmers, professional swimmers. Okay, kaya laging sumasalpak yung tubig sa tenga nila. Okay, because hindi siya common, hindi din siya common natatanong. So, ang i-discuss natin is otitis media, which is a more common disease. So, otitis media is the inflammation of your middle ear. The most common cause with this one is upper respiratory tract infections, tulad ng influenza and pneumonia. So that's why patients should be up to date with their vaccines because upper respiratory infections can cause this one. Okay? To properly diagnose this, doctors can use an otoscope to visualize the tympanic membrane. And usually, they would see that the tympanic membrane is inflamed, mapula, bulging. Okay? And may mga discharge, may tumutulo. Aside from that, because otitis to siya, otitis media, meron din tayong fever, body malaise, fatigue sila, pagod, yan. Body fatigue. And so other signs of infection. Okay? Now, otitis media can present with an acute or chronic condition. Now, acute or chronic. So, i-discuss natin sila kung ano yung difference. During an acute condition, it can manifest itself with pain, otalgia, pwede din fever. Okay? Other signs and symptoms, yan, may drainage from the ear, and merong decrease in hearing. Question, ano ang hearing loss na makukuha ni patient kaya dito? Sensory neural or conductive? Pwede siyang magkaroon ng conductive. Okay? Because ang affected is yung middle ear. Nawawala yung vibrations. Complications nito is meningitis, mastoiditis, especially if kumalat yung infection doon. Once the patient has mastoiditis, magsuswell yung back ng ear niya. So the ear turns forward. So magfo-forward yung ear tignan. Okay? Management nito is broad spectrum antibiotics, usually in otic preparation, myringotomy tube, ilalagay yan sa tympanic membrane to drain it. No? Draining will hasten the healing. We will discuss more on the myringotomy tube. Other nursing management natin is to assess the patient for any other signs of infection. No? Kung mayroon pa siyang mga other signs of infection. Okay? Pain management natin, of course, paracetamol would be the best. Pwede din NSAIDs. For positioning, the best position would be upright. No? So, pwede semi-Fowlers, high Fowlers, ganyan. If there is swelling, alternation of warm and cold compress can decrease any swelling and also pain. Okay? So, ang positioning natin upright para magdi-drain siya. For chronic naman. So, sa chronic natin, ang pinakadelikado lang natin i-discuss dito is yung complication. Pwede siya magkaroon ng cholesteatoma. What is this cholesteatoma? Cholesteatoma is when there is a tissue that grows over your ossicles. No? So, ano mangyayari pag meron ng tissue na nag-grow over sa ossicles? It prevents the ossicle from vibrating anymore. So, mawawala na yung mechanical vibration. So, it can lead to conductive hearing loss. No? Pero pwede pa to siyang ma-repair. No? They just have to remove this skin, this tissue. So, anong management dito? No? Ang management natin dito is tympanoplasty. So, they will have to repair the tympanic membrane. And for the ossicles na nag-fuse na, oculoplasty, they will have to repair that. No? They will have to reconstruct the ossicles. Tatanggalin nila itong little tissue na yan. Okay? So let's talk about your myringotomy tube. Anong ginagawa natin dito sa myringotomy tube? So a myringotomy tube is placed in your tympanic membrane to allow it to keep draining. No? It helps equalize the pressure to prevent accumulation of fluids in the middle ear. No? Additionally, it will improve the hearing and prevent recurrent infections. So nilalagay siya dyan para magdi-drain, lalabas yung mga excess drainage. So what is our post-op care? No? It is important to keep the ears dry as much as possible. No? So keeping the ear dry meaning bawal mo na mag-swimming. No swimming. Bawal din parang ibasa yung buong muka. No? Shampooing. Bawal din mag-bathtubs. Okay? Ganyan. If the child cannot, for example, hindi niya kayang, hindi mabasa, it is a rainy season, ganyan. You can use earplugs. For example, ulan ng ulan, pwede ka maglagay ng earplugs para hindi talaga mababasa. Kung walang earplugs, a cotton that is soaked in petroleum, soaked in petroleum jelly would also be enough. Pwede din to. Okay? Next, other nursing interventions natin is to avoid strenuous exercises, rapid head movements, bouncing or bending. All of this can dislodge. No? It can dislodge the myringotomy tube. Pwede siyang malaglag. Aside from that, it can also increase the pressure in your eustachian tube, which may cause pain. Next, no Valsalva, no drinking through straw, travel to air. So wag mo na airplane. No, because all of this can also increase the pressure inside the eustachian tube no? Which will cause pain. Okay? It can cause pain. So, sasakit yung kanyang ears. So, wag mo na mag-valsalva, drinking through straw, travel through air, forceful coughing, etc. And also, instruct to report if there is excessive drainage, no? Malalaman natin na excessive na yung drainage ni patient if it is greater than uh, more more than once a day. More than once a day. So kung dumadami yung ano niya, excretions niya, you have to report that to the physician. Okay? Now, the tube will eventually fall out. No, mahuhulog lang talaga to siya. Usually, it takes 4 months to 2 years before the tube falls out on its own. Okay? So, it's very important na laging binabantayan to ng doktor. So, follow up, follow up assessment is important. So, kailangan niya magpapa-follow up nito. Okay? Any questions? No questions? Okay, so na-discuss natin na nagbibigay ng broad-spectrum antibiotic through otic preparation. Okay, so paano natin binibigay? So ito yung step-by-step process natin. First, dapat yung kamay natin malinis. Okay, and naka-gloves. Second position, side lying. With the affected ear facing you. Okay, next, warm the dropper. Dapat warm yung dropper natin because if you drop cold, no, pag malamig yun siya, it's going to cause vertigo and dizziness. So mahihilo yung pasyente. So warm the dropper as much as possible. Room temp ang best. Room temp. Next, dapat straight yung ear canal. Okay? Now, when you position, you have to be at least 1 centimeter above the ear canal. And when you drop, no, when you instill, do not aim at the tympanic membrane. No? Huwag ka mag-i-aim sa eardrum because it might cause perforation. Pwedeng mabutas. Instead, you aim at the ear canal, sa side ng ear canal. So essentially, you're allowing it to, tawag yan, drip. No? Parang tutulo na lang siya. Next, to apply, to hasten absorption, no, you can apply pressure at the tragus, no, to have a better absorption. Yan, dyan. Now, if there is excess fluids, no, kung madami pang fluids na lumalabas, okay, you can, you can use a cotton ball at the outermost ear canal. And then, pwede mong gamitin yung cotton ball to drain it. To drain excess. Okay? Now, when you do this, you also tell the patient to lie down for 2 to 3 minutes after nalagay para mas better yung absorption niya. Okay? So, any questions with this one? Any questions? No questions? Okay. Let's have a 5-minute break and then let's continue with Meniere's disease. Okay, let's have a 5-minute break and we will continue with Meniere's disease. Okay, let's continue. So next topic natin is Meniere's disease, and this would be the last topic, the last disease. Okay? So Meniere's disease is also known as endolymphatic hydrops. Ang nangyayari dito, no, to best explain it easier, no, para to siyang glaucoma pero sa tenga. No, there is increased pressure in the inner ears. Increased inner ear pressure. And eventually, this can lead to hearing loss kasi yung pressure sa inner ear would be immense and then it will eventually compress, sisirain niya yung iyong auditory nerves. Pag nasira na yun, hindi nagagana. So, para siyang glaucoma pero sa ears. Okay? So yan. Aside from that, what are the risk factors? Meniere's disease is unknown. Ang risk factor nito is unknown. They don't usually know the cause of this one. That's why it's easily faked. Maraming mga tao sa US and sa UK fake this disease kasi when they do, pwede silang makakuha ng social welfare. Nakakakuha sila ng pera. Okay? So it is unknown. At the same time, it can be associated with aging. It can also be associated with trauma, middle ear trauma, or head trauma. Okay? Signs and symptoms ito. Meron siyang vertigo. The vertigo can be whirling. It can be incapacitating. That's why when you have this disease, you can accept money from the government kasi pwede kang hindi magtrabaho. Okay? Next, meron din unilateral bilateral hearing loss. It is progressive. So over time, nawawala yung hearing ni patient. Okay, and lastly, meron din siyang tinnitus, roaring or ringing sound. Yan. Aside from that, they can also complain of nausea, vomiting, okay, diaphoresis, ganyan. Meron din silang nystagmus. So how do they diagnose this? Audiogram ang ginagamit nila. However, your audiogram is not effective in diagnosing Meniere's disease. The way doctors diagnose this is through symptoms. Symptoms. So what is our management? Okay, management natin, diet and lifestyle modification. Okay? Ang diet dapat ni patient dito is low salt. Okay, because where salt is, water follows. And if there is too much water inside your inner ear, pwede kang magkaroon ng Meniere's disease. So, dapat low salt diet as much as possible. Okay? Aside from that, with lifestyle modification, sasabihin din natin si patient to avoid caffeine, caffeine, avoid alcohol, and avoid smoking, nicotine. Okay? Kung hindi kaya i-avoid, at least lessen lang. But smoking should be stopped. Okay? For diuretics, nagbibigay din tayo ng diuretics dito. What we usually give is mannitol. Okay? Mannitol to decrease inner ear pressure para may ihi siya. Other medications would be your antihistamines, tranquilizers, and antiemetics. These medications are to control the sensation of vertigo. It can suppress the sensation of nausea para hindi din siya masusuka. Okay? Yan. Now, there could be a surgery for this one, itong labyrinthectomy. Now, ang problem sa labyrinthectomy is that it can 100% cure Meniere's disease, but it can also 100% cause permanent hearing loss. So, nakakabingi na siya forever. Yan. So, isa yan sa dapat matuturo natin sa patient. Nursing management natin. So, during attacks, during vertigo attacks, kasi mahuhulog sila. Ang ating gagawin dito is similar to your, seizure precaution. Parang seizure prec lang. Diba ang seizure prec natin is to dim the lights, decrease stimulation, turn off the TV, etc. Ganon din sa kanila. Ang seizure prec natin dapat lower the bed, raise side rails, fall precaution, ganon din. So, Pag during vertigo attacks, similar lang sa seizure prep. Parehas lang yung ginagawa. Okay? Next, stand in front of the patient. As you stand in front of the patient, you tell the patient to look straight ahead. Don't move the head. Huwag niya igagalaw-galaw yung ulo niya. And then you will assist the patient to slowly sit down or lie down. No? Assist to slowly sit down or lie down. Hihiga siya. Okay? Now, when the patient move, we tell them to move slowly. Okay? Dapat their head and their body moves at the same time. No? Or move the entire body slowly. As much as possible, tell the patient not to move the head, not to jar the head. Because the more the patient jars the head, mahihilo siya. Next, no bright lights or decrease stimuli. Okay? So, hindi lang lights, pati din sound, music, bababaan din, yung mga TV, patayin, etc. Support ambulation, kasi pwede siyang mahulog. And lastly, prevention natin. To prevent this one, tapat, low salt, no smoking, as much as possible, avoid caffeine and alcohol, and follow medications. Pwede siyang bigyan ng medications. Okay? Any question with this one? No questions? Okay, let's answer the following. A 40-year-old client diagnosed with Meniere's disease visited the clinic for her monthly checkup. The nurse practitioner began her health teaching with regards to the management of her disease. Based on the findings, so select kung anticipated, non-essential, or contraindicated ba siya. When you say contraindicated, this intervention or this management is harmful. Nakaka-cause siya ng physical or any type of harm. Physical, financial, psychological harm. Okay, basta isipin mo, is it harmful? Non-essential naman, it's not harmful. However, it is not related. Hindi siya nakakatulong. Kapag anticipated, this one is not harmful and it is related. This one is actually helping the patient. Related to mga management sa kanyang condition. Okay? Diet modification, low sodium. Anticipated, non-essential, or contraindicated. This one is anticipated. Very good. Next, myringotomy tube placement. Anticipated, non-essential, or contraindicated. Okay, isipin mo, if the doctor puts a scalpel inside your eardrum, tapos nilagyan niya ng myringotomy, are you causing harm? Tapos hindi niya pala kailangan. You're causing harm kasi the patient was put under the knife for no reason. So it is contraindicated. Proper use of hearing aids. Anticipated, non-essential, or contraindicated. Ang first mong isipin talaga, harmful ba to? It's not harmful, but it is non-essential kasi hindi magagamit ni patient. Hearing aids are for conductive. Meniere's disease causes sensorineural. Okay, next. Assess for Romberg's test. Romberg's test is the test of balance. So, tinitest yung balance mo. So, if you have inner ear problems, would you have a balance problem? Yes, no? Kaya sila nagkakaroon ng vertigo. So, that's why it's important to assess the inner ear, yung kanyang balance and equilibrium. Prosthetic replacement of the stapes. Prosthetic replacement of the stapes. O, isipin mo na naman, isa-surgery si patient nito, tatanggalin yung stapes niya, papalitan ng bago. That is contraindicated, You are putting the patient at harm, kahit hindi niya kailangan pinalitan. Okay, next. Avoid alcohol, caffeine, and nicotine. Correct. This one is anticipated. Okay? Sige, next question tayo. Labyrinthectomy can be performed to treat Meniere syndrome. This procedure results in, number 1, anosmia. Number 2, absence of pain. 3, reduction of cerumen. Or 4, permanent irreversible deafness. So, pag labyrinthectomy, that permanently removes veneers but permanently mabibingi ka na. So, ito yung na-mention ko earlier between conductive and sensory neural. Ang conductive hearing loss, yung kanilang surgery, minimal lang yung chance na magkaroon ka ng permanent deafness. Whereas sa mga sensory neural surgery, it can cause permanent deafness. The nurse is caring for a client with hearing impaired. Which of the following approach will facilitate communication? Number 1, speaks frequently. Number 2, speak loudly. Number 3, speak directly into the impaired ear or speak in a normal tone. Answer is very good. Number 4. No? Dapat low tone, dapat hindi frequent, and if you speak directly into the impaired ear, anong ginagawa mo, di ba? Parang sinisigawan mo yung bingi na tenga. Okay, so next tayo. Next, a 55-year-old client comes to the healthcare facility for a follow-up consultation. He was prescribed with a hearing aid 1 month ago. Health teaching and return demonstration was performed. Okay, select natin yung mga statement ni client dito that is appropriate or not appropriate. I adjust the volume to the maximum hearing level before wearing it. Appropriate, not appropriate. This one is not appropriate. Very good, kasi dapat lowest. Before removing from my ear, I should turn off my hearing aid. Before natatanggalin, i-off niya daw. Appropriate or not appropriate? Yes, because this conserves the battery. I have to use mild soap and water to clean the ear mold. Correct. Appropriate pa rin tayo. I should report any redness, swelling, or tenderness in my ear. Of course, any complication should be reported. Next, I need to be reminded of extra precaution when having outdoor activities. Appropriate kasi baka malaglag. Next, pulling the earlobe is necessary to check for proper fitting. You need to pull the earlobe para magkasya siya. That is not appropriate and it is not necessary. For proper fitting, you wear it like any earphones. Okay? Oh, last, a client with Meniere's disease is experiencing severe vertigo. Which instruction would the nurse give to the client to assist controlling the vertigo? Answer is number 2, avoid sudden head movements. Number 1 is incorrect because increased fluids increases pressure in our ear. Number 3 is incorrect kasi dapat walang TV. Number 4, dapat low sodium. Okay? So we are done with your special senses. Pero wag mo na kayong aalis, may exam tayo. Okay? So we are done with your special senses. Any questions before we take the exam? Any questions before we take the exam? No questions? O sige, exam muna tayo ha. Okay lang ba? After exam, madali lang yung exam. Mga, I think 20 items lang ata yun. Okay, after the exam, we will have rationalization. So it's good for 30 minutes. Okay? So hintayin lang natin ha kasi ipopost yung exam. Bakit madaming umalis? Okay, nakapost na daw yung exam. So I'll see you back after 30 minutes. Okay? Hello, may nag-answer pa sa inyo. Meron pa nagsasagot dyan. Okay, sige, may 5 minutes pa na. May 2 minutes pa naman. Okay, start na tayo. Off ko ng video ko ha. Okay, number 1. The nurse is making a follow-up phone call on a client with cataract surgery. Okay, the nurse receives which client reports requires priority. So, ang answer natin dito is number 2. Because kung constipated siya, magsistrain siya. And when they strain, pwedeng tumaas ang intraocular pressure. Number 2. The nurse is speaking with a parent of a toddler who believes the child has hearing deficit. Which finding supports this suspected diagnosis? So, akala nila bingi yung anak. So, the answer is number 1, behavior patterns appears withdrawn. Nag-e-echo? Hello? Okay, the behavior appears withdrawn, ibig sabihin, no? Parang hindi siya nakikinig, parang apathetic siya. Next, number 3, monotonous speech. Ibig sabihin, the child cannot hear what, no, he sounds like, kaya monotonous yung speech niya. And lastly, number 5, speaks in a loud voice, again, kasi hindi niya naririnig yung own voice niya. So the answer is 1, 3, and 5. The nurse is caring for a client with partial hearing loss. Which intervention should be appropriate to promote effective communication? Okay, number 1, incorrect. Kasi when you dim the lights, no, hindi ka makikita approaching. Next. Number 2 is correct. Number 3, mali. 4 is correct. Dapat directly facing. And lastly, tell the family to take the hearing aids home. So mali. No? Because if you take it home, ibig sabihin, hindi mo dala-dala. No? Hearing aids should be kept at all times. So 2 and 4. The nurse is performing a visual acuity test, no, for a group of students. Which of the following student does the nurse recognize has possible myopia or nearsighted? Okay. Number 1 is hyperopia. Number 2 is correct. Number 3, also correct, squinting or closing one eye. Number 4 is also correct. Number 5, mali. Because this one is color blindness. Kung hindi niya alam anong color ng socks niya. Next, number 5. The clinic nurse is preparing to test the visual acuity of a client using a Snellen chart. Which of the following identifies accurate procedure? So the correct answer is the right eye is tested followed by the left eye and then both eyes are tested. No, mali si number 1 kasi both eyes first. Mali din si number 3 kasi dapat 20 feet lang. Number 4 mali din kasi dapat 20 feet lang. The client vision is tested with the Snellen chart. The result is 20/50. The nurse interprets this as, okay, the client can only read at a distance of 20 feet what someone with a normal vision can read at 50 feet. So number 4 ang answer. The nurse is performing an assessment on a client with suspected cataracts. The chief clinical manifestation that the nurse should expect in the early stage would be blurred vision. There is no eye pain in cataracts. Floating spots would be retinal detachment. Diplopia is another condition. The client is being discharged following cataract removal. The nurse providing instruction regarding home care. Which of the following, if stated by the client, indicates need for further teaching? Answer is number 1. Aspirin increases the risk of bleeding because the drug of choice for post-op would be paracetamol or acetaminophen. Number 2 is correct. No? Dapat unoperated side. Number 3 is also correct. Eye shield at night, glasses during the day. Number 4 is also correct. Do not lift anything greater than 5 pounds because it will increase intraocular pressure. The nurse is performing an admission assessment on a client diagnosed with retinal detachment. Which of the following symptoms are associated with retinal detachment? Answer natin. Number 3. Number 1 is macular degeneration. Number 2 is blindness. Total vision loss is blindness. Number 4 is associated to a liver condition, no, icterus siya. So number 3 is the correct answer. The nurse has noted the physician has a diagnosis of presbycusis on the client's chart. The nurse plans care knowing the condition is presbycusis is a sensorineural hearing loss that occurs with age. Number 1. The nurse is reviewing the physician's order for a client with Meniere's disease. Which diet will be most likely prescribed? Number 2. Low sodium decreases inner ear pressure. Okay. When teaching the client about Meniere's disease, which of the following instruction would a nurse give about vertigo? So the answer is number 3. Get up slowly, turning the entire body. Number 1 is incorrect because a client who has vertigo would know na maghihilo talaga sila. Number 2 is incorrect because drive in daylight hours only. No, dapat kung meron silang vertigo, they should avoid driving at all. Number 4 is also incorrect because lag roll method is indicated for spinal condition, spinal problem. The nurse has an unlicensed assistive personnel caring for a client with acute attack of Meniere's. Which action by the UAP requires follow-up? No, all of it are correct except number 3. Because if you raise all side rails, you put the patient, no, you put the patient under false imprisonment. No, false imprisonment. Because you need a doctor's order to raise all side rails. A client comes to the ED reporting alkaline drain cleaner splashed to the eye. The conjunctiva of the affected eye is erythematous, and the client reports burning sensation. What action is appropriate? So if there is something in your eye, you have to continuous eye irrigation to wash it off. The nurse is performing an assessment on a 2-year-old with otitis media. Which of the following actions should be appropriate? So I call it apply. Okay, number 1 is correct. A speculum is like a little hole, parang ganyan, kung asan pinapasok yung otoscope. So, again, you do not insert it in the bony interior. No? Encourage the parent to have the child vaccinated. That is also correct because otitis media, the most common cause of this is upper respiratory tract infections. Inspect the tympanic membrane for redness, bulging, and perforation, also correct, because the normal tympanic membrane would be pearl gray. Number 4, pull the pinna up and back is incorrect because the patient is 2 years old. Dapat down and back. Number 5 is also correct because since the patient is 2 years old, this is considered as an invasive maneuver and it should be done at the end of the assessment. A football player is brought to the ED after a helmet-to-helmet collision without the loss of consciousness or signs of external trauma. Which clinical finding warrants immediate intervention? The answer is number 1. A hairnet-like vision is indicative of retinal detachment. Okay. Number 2, loss of memory during collision is expected. Temporal headache during collision is expected. Tongue laceration and oozing blood is dangerous. However, your patient is conscious. Ibig sabihin, the patient can actively clear his own airway. So, pwede niyang idura yung dugo. Number 4 becomes a priority kung unconscious yung patient. Okay, so number 1 ang answer. The nurse is reinforcing education about lifestyle modification for client newly diagnosed with Meniere's. Which statement by the client indicates need for further teaching? The answer is number 2. Kasi hindi potassium nire-restrict natin, sodium ang nire-restrict. Which of the following tests provides a quantitative measure of hearing? The answer is number 3, audiometer. All of the following are just assessment tools and cannot determine if a patient has a hearing loss. The tympanic membrane of a child with otitis media would be otitis, so inflamed siya. Number 3, distinct red color. The nurse observes a student administer eardrop to an elderly client to help loosen cerumen. The nurse intervenes when the student performs which action? The answer is number 2. Kasi when you occlude the ear canal, you're too close. Dapat at least 1 centimeter above ear canal. Okay? So we are done. Any questions? Any questions? Any questions for the exam? No questions? Okay, so lahat ng na-discuss natin, lumabas sa exam. So thank you very much for attending your special senses. We ended, nag-extend lang tayo ng 2 minutes. So okay lang yan. So thank you very much for attending and I hope you have a blessed night. Bye-bye, ingat po kayo and happy holiday.
Thank you so much, sir. Nurses, announcement. Our class tomorrow is ERDN by Sir Greg. And don't forget to evaluate the lecturer. And huwag po natin kalimutan na ilagay yung score natin sa tracking card. So, please, see you tomorrow po. Thank you, sir. Thank you po.